Okay, well, good afternoon, everybody. This is the first time we've ever had a video conference with the Las Cruces City Council. Today is Monday, March 30th, 2020. It's quick, 2 p.m. Just a quick happy birthday to my dad. He would have been 90 years old today. So before we begin, I'm going to turn this so you can see a flag of the United States. Hopefully you can see it. Just have a quick pledge of allegiance. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. We're official. Let's go ahead. We've got some representatives from the hospital that we're going to, they could just identify themselves, and then they have a couple things they'd like to say, and then I have a couple questions to ask. Then our OEM, Mr. Colin Combs, there's a question for him, and then we'll turn it over to council for any questions that they may have. So I know Janice, I believe, is out there, I hope. And if you want to start it off, or whoever from MMC, Memorial Medical, please identify yourself, and we'll go from there.
Here behind me, I have Karen Iverson, who is my CNO. And behind her, raise your hands as I introduce you, is Mary Armijo, who is my associate administrator. And then behind Twilight is Ryan Perkins, who's the director of marketing.
Okay, great. Well, good to see you there, John. And I'm sorry, who the lady across from Karen? I didn't catch that one.
Across from Karen is Twilight Anderson, who is our infection preventionist.
Twilight? Okay.
Yes.
Twilight, yes.
Great. Okay, so would you want me to just go right to the questions, or did you have something you wanted to start off with?
No, I think let's go right to the questions, because that'll be the most productive use of your time.
So, is there going to be one hospital dedicated to COVID-19?
The answer, Twilight, you want to answer that?
No, Mayor, there's not. This is a pandemic, and every facility in New Mexico needs to be prepared and able to take care of patients from their area, and with or without COVID-19. But no, there's no delineation for facilities being a COVID-19 facility.
And just to clarify on that, Mayor, what we ask is that the surrounding hospitals, not all of which are as diversified in services, nor do they have necessarily the depth in services or the diversity of specialties on the staff as we do at Memorial. Certainly a hospital like Mountain View is an analogous situation to ours, but those that are smaller, like Deming and Silver City and Truth or Consequences, even Alamogordo, they will on occasion have patients based on how sick they are, what we call acuity. We'll transfer those patients into us if the bed is available.
Okay. Not sure if you saw the today's news that there were some great volunteers, people working on homemade masks, and just wanted to know if you all think that you would be needing those, and if so, how would we get those to you?
Sure. Mayor, this is Twilight Anderson again. Yes, we are accepting donations of homemade masks, and that is going through our supply chain director, Linda Whitmire. And homemade masks will be put in reserve to be used as a last resort. And that meaning when we run out of our regular PPE and masks, if we exhaust those supplies, then we would move to a cloth or some type of homemade mask at that point. So yes, we would not turn away the donation. We would accept it gladly and very appreciatively, but we would hold them in reserve to unless at what point we would run out of our PPE.
Okay. In fact, that was going to be my next question was, has there been a the projected status on your PPEs and whether or not, I mean, you know, you hear reports every place that the demand is great and the supply is very low. And so just wanted to know if you've projected what you need. Are you guys fine? Do you need some assistance from the city?
Sure. Mayor, again, this is Twilight Anderson. Daily, we are looking at our PPE supply and our calculated burn rate for the day and where we are and what comes in. And we have received from the state some supplies, and that's been put into our inventory. And so at this time, based on our volume, we're actually doing quite well today. But if we had a surge, of course, you know, for every patient in isolation, we would have a greater burn. But again, we're just looking at that every single day and recalculating and monitoring very closely.
Right, and this is Karen Iverson. So part of that is we also look at the resources and how many we're going to need. And so we're not just giving them out to everybody that says we need them. We give them out appropriately. So we want to make sure that we do have that reserve in the back, and just in case that we do get that surge.
Okay, and I don't know if you can answer this, but let's take the senior care facilities, for example. Obviously, they're a little bit higher risk community. How do they get their PPEs? Do they come through you? I mean, I know there are nurses there. I don't know how do they just do it directly?
Got to be through their supply.
Yeah, Mayor, this is Twilight Anderson. They should have their own distributor or supplier that they get gloves. I'm assuming undergarments, other things that they need to take care of that population. And so that distributor or supplier would be the ones giving them the needed PPE for their senior center, whatever population they're caring for.
Okay, and this is going to be the question I'm going to be asking Colin, but perhaps it obviously pertains to you as well, is how would are we prepared for a surge? And if so, what advice would you give to the community? If there was a surge.
Go ahead.
Okay.
I'll add.
Mayor, this is Twilight Anderson again. Yes, we have been preparing the last 3 weeks for a surge. We have been following all of the guidance that we've received through CDC and through the state and our governor. And so we have looked at our census, we have looked at our patient flow, we have our nurses trained, we have a designated area where we're looking at our suspect patients and containing, and again, that's one way we're controlling the burn of our PPE, and managing with our physicians and nursing team patients. So, you know, we have, yes, licensed for 199 beds, and that would be our capacity most likely until we would move off-site to a alternate care site. And so all of those plans have been in place, and we are just monitoring the situation very closely at this particular moment.
So this is Karen. What I would ask you to tell the public is to stay home. The biggest thing that we see all the time is people are wanting to come in to get tested, and they don't meet the criteria to be tested. And so if we do get a surge, we need to take care of those patients who are in respiratory distress, not the walking well is what we're calling them. Those individuals pretty much need to go home and stay home and ride it out for at least 14 to 21 days.
Got it. Okay, so those are the questions I had. I'm just kind of see if any, it's like Councilor Vasquez and then Councilor Sorg have questions. So Councilor Vasquez?
Thank you, Mayor. Much appreciated. Thank you to the staff at Memorial Medical Center for all your hard work and preparation for this moment. For the folks at Memorial Medical Center, I do have a question on homemade masks. I understand there's some different degrees of protection that you can afford with staff, that the members of the public should be using, that perhaps other frontline workers like grocery store clerks, gas station operators, folks interacting with the public should be using. Do you have any guidance to the public as far as what type of masks you that Memorial Medical Center staff should be using versus the type of that like frontline workers should be using? And from what you've heard, is there a shortage of each that the community can help meet those guidelines to get to get that equipment out effectively across the community and across workers?
This is Twilight Anderson. From an infection control and prevention perspective, we know that this virus spreads by droplets. And so that social distancing that we keep talking about is really the best prevention we have. And there is not a recommendation that the population or people or workers should be running around in masks, because really we want to only put the mask and save the mask for what we call source control. That if that patient presenting to us is symptomatic, we would want to put a mask on them to control this. And we don't need to control the population as a whole and by wearing masks. And so that is, currently the recommendations, that's what we understand. We need to do social distancing because this is not an airborne disease, it's droplet. So that 3 to 6 feet, not having large crowds is really the prevention strategy.
That and washing your hands.
And washing your hands using soap and water, alcohol hand rub, and ensuring that you don't touch your eyes, nose, and mouth without clean hands.
Yeah, I think one of the biggest things is keep your hands away from your face. Don't rub your eyes. Don't put your fingers in your mouth. Don't touch your lips. I mean, you really, all human beings have a tendency to do that type of thing, and you just need to make a conscious decision not to touch your face as much as you can.
Thank you. And just as a quick follow-up question to that, the reason I asked that is because potentially we do have residents in the city, I have witnessed myself, right, who are wearing some degree of PPE or levels of protection in public places, in particular grocery stores. And so if the city's PIO could actually give guidance to the public on, hey, if these are the top 3 things that you could do to keep yourself healthy. And then additionally, if you have equipment that's available that could be made available to staff at the hospitals or other places, we should be getting that out because from a quick trip to the grocery store, you can see that maybe half of the people are wearing masks, the other half are not. So there seems to be some confusion about what the best method of protection are, but also making sure that if people have masks, that they're not needed out in public use, that they make it to frontline workers or to staff at the hospitals. So with whatever inventory we have in the city, just want to make sure that that's being used effectively. And if the city can get that information out, I think we should. So is there any guidance at all into who should be using masks and who shouldn't that the city could perhaps provide?
Again, this is Twilight Anderson. People wearing masks gives them, I think, a false sense of security when they're out and about. And again, we probably can't control that if they have the mask and they want to wear it. But really, it's the social distancing, not going out, staying at home like we're supposed to, only essential personnel out and about, washing our hands, not touching our face, doing all those things will prevent the spread of this virus. And again, cleaning. I mean, we have to wipe down. I was at a grocery store yesterday doing my own shopping, and I was very impressed. After every customer, they were wiping down the area. And I think that's what it's going to take to prevent the spread out in the community. And again, we need to clean our hands as well when we're out and about.
They also need to be aware. I mean, Twilight and Karen are walking experts about this type of thing. They have combined with others around them to prepare Memorial extremely well in all the operations that we have. The key thing is, again, quarantine yourself as much as you can. Don't get into large groups. Social distance yourself. And a lot of people are just not doing that. You see the films when the governor, or for that matter, the mayor in New York, they're talking about what they're doing in New York. And you see these young people that are socializing in parks, and they're right next to each other. And you see the spread that's occurred in New York, and I realize that's not the only reason for it, but it's just these fundamental things that both Karen and Twila know that need to get out there, and how long this virus can live on surfaces. You know, it will live for different lengths of time on different surfaces. Twila?
Correct. So we know like plastic, solid surfaces, metal, it'll last there for days. And so that's why cleaning and washing our hands, I can't stress that enough, washing our hands is the best prevention we can do to not get this virus.
Thank you so much. I appreciate it.
Yes, yes,
I
Christine.
do have a recommendation to make.
Councilor Vasquez, can you hold for just 1 second? I think Christine needed to jump in real quick.
Can I get everyone
Yes, absolutely.
name before they speak, because I'm taking notes and I don't know who's speaking.
You need
Sure. Oh.
council members or even from the MMC staff?
The MMC, any staff that's speaking. Because I
So
can't.
basically, anyone. Okay.
Okay.
That's doing pretty good.
Thank you, Mayor. This is Gabe Askest. Thank you so much. I appreciate that. I just have a recommendation to our Public Information Office, to my colleagues on the council, and to you, Mayor, to get that information out. You know, I think it's important for people to understand that a mask is not going to protect them, that they can't simply resume, the general public can't resume, you know, life as they know it by wearing a mask. And I think that's maybe what I've seen in some public settings. And so I think that's good information to get out. The last question that I do have before passing it over to my colleagues, to the Memorial Medical Center staff, is, as you may know, the council recently passed an ordinance that allows the mayor to declare an emergency, a state of emergency that limits the ability of people to gather in certain numbers or in certain public places. I did see this weekend some photos of our community members gathering in different ways, things like playing pickup basketball, right, in large groups in different households. Folks also out on their bicycles in large groups. And from what I'm hearing from you is that that's the number one thing that we want to prevent. And so I'm wondering from Memorial Medical staff if you have a recommendation on whether the mayor should enact an emergency proclamation that would limit the gathering of certain people, as you mentioned in New York City, what that has caused, what your advice would be to the city and to the mayor in terms of actually making that an enforceable type of event for people to gather. Are we at the stage where we want to do that now?
This is Twilight Anderson. As an infection preventionist, I'm going to say yes. Unfortunately, we would like the public to take recommendations and follow through. But I think we see behavior, you've seen behavior that they just don't take it seriously enough. They don't think they're going to get sick. They're young and they're bored and they want to be outside, and you know, they call their friends and they all get together. Understandably, but these are not normal times. This is not the behavior that we should have right now with this virus in our community. So if we're going to make a difference and prevent the spread, then we need to stay at home as much as possible. And only one person should go out and do the grocery shopping. It shouldn't be the whole family. That's very concerning to me when I see mom, dad, kids, and everybody's running around. I'm like, no, they didn't get the message that they really shouldn't be out as a family group like that.
And this is John Harris. You can have C19 and be asymptomatic, not have any symptoms. So to support what Twilight is saying, we can't impress upon you enough to get the message out. If people will undergo the personal sacrifice, exercise the control, not to socialize, in groups, not to get together and play poker, for example, not to get together and play pickup basketball, but to do these things, control these kinds of things, then over this window of time, we're going to be able to control this problem much more readily. I mean, you just can't impress that enough on the population. Well, Karen, what would you add to that?
No, I agree 100%. Twilight and I had this discussion this morning where it's getting warmer outside and people are wanting to go picnicking and doing all this kind of other stuff. And so you'll start to see big family groups at the levee having their picnics, and we saw some of that this weekend. So it's how do you get that message out to them to say this is important, because you may not show signs and symptoms, but you may have it and you give it to that next person. So I totally agree with Philo. This is something that we need to do now, because if not, we're going to be doing it soon.
Yeah.
Thank you so much for that assessment. I really appreciate it. And would definitely encourage council and mayor to follow, the directives of our healthcare professionals who are on the front line. I think the threat of a misdemeanor citation might be what it takes to get people to stop gathering, as our healthcare professionals here have talked about. And so with that, I will pass it on to my colleagues. Thank you, Mayor.
Well, this is John Harris. One other thing, we don't know at this point whether this virus is sensitive to heat or cold, do we, Twilight?
No, we don't have enough.
So, there's a misnomer out there that, well, when the temperature warms up, this will go away. Not necessarily.
We're hoping.
Yeah. Good point. Thank you. Councilor Sword? Councilor Sword? Okay, we'll go to Councilor Abeta Stubbe and then go back to Sword if he's there.
Thank you, Mayor. And thank you, everyone at MMC for joining us and helping answer some questions. I have a few right now. One of the ways I was wondering what types of decontamination protocols or considerations are going to be needed for your staff should we have a surge, and to make sure that they're staying as safe and healthy as possible, and then when they're going back to their families.
Sure, this is Twilight Anderson again. So our cleaning and disinfection practices have pretty much remained the same. The products that we use, none of them can tell us they kill COVID-19 because they haven't had an opportunity to run all of the tests that they would need to be able to label their product as being effective against COVID-19. So, but we know other coronaviruses, our products are effective against. And so as a non-envelope virus, we're looking at saying this should kill it, but if not, just the mechanism of cleaning and getting that organic material off the surface, then again prevents the spread. So just like soap and water, probably soap doesn't kill the virus, but the mechanism of washing our hands removes it from our hands. And so that's the same principles that we're applying here at work. And we are cleaning, all the high touch areas like doors and door handles, and just anything that people are touching, we are giving that extra attention in our facility.
So also, this is Karen Iverson. Just what we educate our staff is, and I hope they do this all the time, is when they get home, they don't walk into their doors wearing the same clothes that they wear in this hospital. Not only do we fight COVID-19, but we also fight MRSA, VRE, ESBL. There's bugs all over this. So we want to make sure that when they walk home, they leave their shoes outside and then they strip and go into their house. And we did supply our staff with different sets of scrubs. So if they don't feel comfortable when they come to work, they can come in their street clothes, change, and then change back out of the scrubs and then put their street clothes and go home. So we have made mechanisms and concessions for that as well. Right.
Thank you. And since we've had a lot of changes on what type of services are available, I think it's important for the public to know what types of medical services are still appropriate to come in for at this time.
So this is Karen. So anything that is an emergency or what we consider urgent that cannot wait. If they wait, then it will cause life or limb harm or a progression of their disease process. Anything that would be considered elective,
90-day window.
A 90-day window. that can wait up to that point, we ask them to wait. But anything emergency, we still are in that business.
Thank you. And you kind of touched upon it, Twyla, just a little bit ago about seeing families out and about in public. What might be the best possible way for single parent families to be able to go out in public while still staying safe as possible? So you have a single mom or dad and they have to bring one of the little ones. What types of protocols should they be thinking about that if they have to bring in some of the little ones with them?
Great. Just to be clear, this is Twilight Anderson. I just want to make sure you mean to go out shopping because they're single mom and dad and all that. Yes, curbside, you know, the stores that offer, you know, pickup of your groceries, I would definitely recommend go ahead, put in your order, and then just drive by and pick it up, or you don't have to go into the store. So I think, you know, the stores and restaurants that are delivering and doing those things to help support individuals at home to use those resources instead of going into the grocery store. Because going into the grocery store with little ones, I think is really not a very wise decision at this point.
This is John Harris. What we have to remember is it's hard enough to train adults on all the things that we're talking about. Young children are the least compliant of the group. They'll hear these things, but they don't comprehend them necessarily, and they won't do them as a result. And it's better not to take them out in public. Keep them at home. Find things to do with them at home. Play video games. Play in the front yard. Play in the backyard. Do those kinds of things. I have 7 grandchildren, and that's what they're doing in Dallas.
And then one final question. Have you had any challenges, or have your employees had any challenges balancing daycare needs, work schedule, given the closures with LCPS, or even finding resources, since we know those are limited, off their work hours?
So this is Karen. Actually, we were a little bit surprised and thought maybe it was just spring break because everybody already had plans for spring break. But we haven't heard of anybody complaining or needing assistance. There's been a couple that will do like changes, like split shifts and stuff like that, so they can change with the other parent and that kind of stuff. But really haven't had any of those issues to speak of.
Okay. Thank you very much, and thank you for all the work that you've been doing. Thank you, Mayor.
Thank you,
Thank
Councilor.
you.
I don't know if Councilor Sorg, are you there? Do you have a question? And then we'll go to Councilor Bencomo. You're not coming on, Councilor Sorg. So let me have IT. I think they're out in the hall. Let me have them go to you. So let me go to Councilor Joanna Bencomo.
Thank you, Mayor. Can you all hear me?
Yes.
Yes.
Great. And thank you so much for all the staff of the hospital. It's funny and interesting that every time someone says don't touch your face, my eyes itch and my entire face itches. So, but thank you for all of that. I have a couple questions. I really appreciate you all giving advice to us and to the general public. I wonder what kind of advice you would also give to grocery stores and other essential businesses that are currently open in terms of cleanliness and those kinds of things.
Sure, this is Twilight Anderson. Overall, I have to tell you, I've been impressed with the stores. I believe they have tried to keep wipes available so that you can wipe off your cart. I've also seen an addition of hand sanitizer at the entrance of the doors. I have seen many people activate that hand sanitizer and clean their hands. And again, I just think we have to be aware that going in public places that we are touching where everybody else has been touching, and that, again, we have to wash our hands, clean our hands. So I know when I get done shopping, I activate that alcohol hand sanitizer leaving one more time, and I'm going to clean my hands when I get in my car, likely, and wash my hands when I get home. So that's what it's going to take. Just, we call it breaking the chain of infection, that hand hygiene moment each and every time is just one more opportunity to break the chain of getting infected.
And this is John Harris. If you feel the urge to cough, to sneeze, into your sleeve, into your elbow. Don't cough, sneeze into the ambient air. Karen, would you add anything to that?
No, Twyla's exactly right. And I can tell you also, I was in Sprouts yesterday and I hate shopping, but I couldn't get my husband to go for some reason. And if you take in your bags from home, they actually won't even touch those. They'll let you bag your own stuff. So they're taking those extra precautions.
So I think they're doing a good job, the grocery stores.
Yeah.
Thank you. I agree. And oh, go ahead.
Yeah, this is Mary Armijo. One thing I will tell you is like the big box stores,
Yes.
like, you know, Walmart or Lowe's or Home Depot, tons of people all together gathered in those locations. I know over the weekend, I'm sure people are wanting to be outside and gardening and things like that, but there were a lot of people parked in that parking lot in a lot of the big chain stores. So, you know, I don't know how you can handle that because I know they're essential businesses, but a lot of people, fully packed stores can limit access.
This is John Harris again, and as you buy these products, I can tell you, this may sound obsessive compulsive, but with what we're dealing with, when you buy the products, when you get home, wipe them down. Because you don't know who's touched them. You don't know who's coughed or sneezed on a box of cereal or something like that. Just to take that precaution.
Great, thank you. I was reading an article about how after all of this, we might all develop some sort of form of OCD, right? And cleaning everything in our hands, which isn't necessarily a bad thing. Thank you for that. I really appreciate it. And you know, as I have the video, I would just want to thank all the grocery store and essential employee workers who are going to work every day. You mentioned, and you said, you know, you have your bed capacity and are not there yet, and that there's an alternate care site. Is that there could be? Do you have one available already?
Sure. This is Twilight Anderson. For Memorial Medical Center, our off-site healthplex would be one area we would look at to maybe offload stable patients if we had to. Again, it's our facility. We can just get things set up and over there as an alternate care site. We have clinics, family medicine clinics, if we needed to, particularly offload for the ER if we got a surge and we needed to do more type of triage. That clinic is right here on our campus, and we can open that up to ER patients. So I think you probably have seen our tent sitting and set up here in the front of the hospital. That too, we already have our plans if we get a surge of being able to look at all of our respiratory patients through that tent and deciding whether or not they needed to come in the hospital or not come in the hospital. So again, we have a lot of contingency plans in place, ready to activate when, if and when we would need to.
That's amazing, and it's really good to hear from all of you. Definitely makes me feel much safer and better. Just a couple more questions. Remind me, if someone needs to be hospitalized because of COVID-19, do they need to have insurance to be treated?
No. So they would come through the emergency department. That's where they're coming through at this point. And so because it's an emergency, it falls under the emergency EMTALA, and we would see that patient. They would not go into our major population, though. They would go into what we consider our COVID unit.
Okay.
No matter what.
Yeah. No matter what insurance.
Yep. That was Karen.
So sorry.
Thank you very much for that. And then my last question, and this is probably towards the council and maybe some staff as well. Several weeks ago, I had asked about protocols regarding Border Patrol internal checkpoints. And I know that, you know, as city councilors, our duty is to the city of Las Cruces, but I also worry about our neighbors to the north, the west, the east, should they need medical attention in Las Cruces. And I feel like we haven't really gotten a response in terms of if someone is undocumented or their family members are undocumented and they need to come get treatment in Las Cruces. how would that work? I don't know if folks from the staff of the hospital have any suggestions or advice for that, but I would like to make sure that we get that kind of information, or perhaps even work with our federal delegation to try to get that resolved.
Well, first of all, just to clarify, this is John Harris. We treat all patients that come to our doors, regardless of what country they're from, where they're from. And from an EMTALA standpoint, that's a federal regulation to begin with. So Karen, would you add to that, since the emergency room reports to you?
Yeah, so when a patient comes into our emergency department, we do not question what nationality or anything else. So we would treat them no matter what. So if the Border Patrol brought a patient to us, we would treat, and then if we had to release, we would release back to them. If we had to admit, we would admit. And that's our process. On the Border Patrol outside, though, I would tell you that one of the things that we've heard is that they need masks. And as long as they're 6 feet away, they don't. And so that's one of the things that we need to make sure that they understand as well. But if they're going to be up close and personal, they definitely need a mask.
Thank you. Thank you. My question is more so in terms of, and I really appreciate you restating that, right, that you will treat and serve anybody regardless of their status, income, whatever. I think that that's exactly what the healthcare system is for. My concern is that there are checkpoints internally that might not allow people to get back in. You know, they can come to Las Cruces, but they might not be able to leave, even though they came and were being responsible about their treatment. All in there. Hopefully, maybe staff, I don't know, Mr. Mestas, I'm hoping maybe you can write this down, and so we can get an answer on this. I would really like to know. And then just one last, Karen, remind me your last name.
It's Iverson.
Iverson. I just want to give you major shout outs on social media. Thank you.
Oh, thanks.
Thank you, Councilor. And before we get to
This is John Harris. Karen has nearly 25 years as a chief nursing officer, and she's lived in Las Cruces for many years. She had worked down in El Paso at a hospital there, and I recruited her here to provide her talents at this hospital. She has many years of experience. As does Twilight. Twilight, you'll recall, is the one that created the flu shot drive-up opportunity for all of our citizens, and we provided over 3,000 flu shots for citizens in the area. I will also tell you one quick thing, and I know we have one other person. This hospital is the only leapfrog A hospital in all of southern New Mexico. It is in the top 10% of hospitals in terms of quality and safety of care. It's one of only 100 hospitals in the nation to have that distinction. And it's 5-star in surgery, 5 out of 5 stars. So my point is, doing what we're talking about today is not foreign to us. We know the discipline. We know what's necessary to succeed in this. So we appreciate this opportunity to talk with each of you.
Thanks, John. Before I get to Councilor Sorg again, and then Mayor Pro Tem Gonda, Mary, can you state your name one more time? I'm not sure if we got it for the clerk. Mary or Mary Ann?
Oh, it's Mary Armijo. It's Mary Armijo.
Mary Armijo. Okay, great. Thank you. Okay, so let's try Councilor Sorg. I think we're ready to go with him. Councilor?
Okay, Mr. Mayor, thank you so much.
All right, there he goes.
I have also been concerned about the same things that the other counselors were asking you about. And I'm glad they asked the questions, because those are the same things I wanted to ask. There's just a couple of things that I'm concerned about, and that is, do you have any COVID-19 cases in your hospitals now?
Currently, no. This is Karen. We do not. We have no positives.
Do you know if Mountain View does?
We do not.
Okay. I can see that you're extremely well organized, and that's wonderful. Thank you so much for that. I just wondered another thing. Has the state of New Mexico helped you with any of the things you're doing to prepare for COVID-19?
Yes, sir. This is Karen. So the state actually is the one that provided the tent that you see outside that we did our drive-through clinic for them. They had requested that we do a testing site for them. So we did that a week ago Sunday, and and we tested over 220 individuals. Out of those 220, we had 2 positives, and those were down from El Paso that drove up to get tested. So, yeah, so the state has helped, and the state has delivered test kits as well. And so those test kits we use for anybody that walks up from 9 to 1, Monday through Friday, to get tested. And so we'll send those back up to the state.
Okay, that answers my last question. If a person needs to be tested, that is what you do then? A person can do is come to the hospital between 9 and 1?
Correct. So they still have to meet the criteria, and they can come in, and as long as they meet the criteria, we will test them between 9 and 1 outside in the tent. And then those test results, we send those up to the state to get the results.
This is John Harris. May I interject and just ask Karen? Karen, would you, when you talk about meet the criteria, what are the criteria that they have to meet?
And I'll let Twilight do that one.
This is Twilight Anderson. So again, we are asking about travel, any sick contacts, and if they've traveled, and if they have any of the classic signs and symptoms of COVID-19, which is that fever, shortness of breath, cough, and fatigue. And if they have any symptoms, we're going to go ahead and test them. All right. So I just want to augment to what Karen Iverson said, is also the Department of Health in the mornings from 8 until noon, they are taking appointments for testing as well. So we're trying to assist the Department of Health with testing our community, and so that we can understand what the prevalence is in our region, so that we can better prepare and know what we're facing with this particular virus.
Oh, thank you very much. That is very important, I know. And I hope the public understands how important it is that we keep a track on who has the virus and who's well. Okay, that's all, Mr. Mayor. Thank you.
Okay, thank you, Councilor. And I believe Mayor Pro Tem Gondeta is next.
Hello, can you hear me?
Yes.
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 I just, thank you so much, John, Twyla, Maria, and Karen, and for all your work. Please pass on my gratitude to the doctors and nurses and staff. I so appreciate what you're doing every day that you put your lives on the line for us. It doesn't go unnoticed. And so I wanted to start off with that. Kudos to all of you. I had been asking for a few weeks now, making sure that you all had the tools, the supplies that you needed. I know that you've answered, you have plenty of PPEs and whatnot, but I had been reaching out to Cruces Creatives, and they came up with a proposal for me as it relates to the PPEs and various kinds, not only the fabric ones, but a face shield, the 3D printed plastic face mask with cartridge filters, and just wanting to hear from you all. I had understood maybe you're doing some testing of these materials or supplies, and I just want to make sure that if that was, as it was last Friday, I submitted a proposal to council about giving some funding to Las Cruces Creative just to make sure that our personnel had what they needed. So my question is, are those things that you find useful, beneficial, science-based, and that you could use automatically?
Sure, this is Twilight Anderson. Again, equipment and supply that hasn't gone through that vetting through industry of being healthcare qualified, we're going to use the PPE that has been vetted first. But when it comes down to last resort, what these engineers and what our public is doing to help support us, we may need. None of us have a crystal ball and know what's going to happen with this virus. And so I know these 3D printers with the cartridges, this type of mask, is probably going to be better than nothing. And so I will tell you that I haven't seen a prototype yet. I heard that they were working on it. But definitely, we will look at, and I think, again, this spirit of just coming up with ideas and what can we do differently? When I looked at Dyson, going to make ventilators, and, GM going to make ventilators for us. I mean, that's pretty amazing work. And so I'll bet you we're going to use those ventilators without having things vetted like we normally do. So in a time of crisis that's unusual and we're in a pandemic, we're going to do whatever necessary to help take care of the patient.
Okay, but at this point, you're not in need of those, correct?
Not in any desperate need, not at this moment.
Okay, great. My next question has to do with, I had heard, and please reject that rumor. Have you decreased any of your, you have a restaurant or a cafeteria there. Have you decreased your meals there for folks? And if so, how can the city help you to ensure that your staff and physicians and nurses are getting the nutritious meals that they so deserve?
So that's a great question. This is Ryan Perkins, and we've actually been getting a fair amount of donations from some of the different organizations and companies throughout that really want to help those workers on the front lines. Yes, we did. We went to a zero visitor policy, which means that we were able to adhere to what the governor was asking us or ordering us, in that you can't have gatherings of more than 5. So what that allowed us to do is close down the seating area, but we're still operating that like our cafe is still operating similar to a takeout restaurant, where our staff can get food during limited hours. And then additionally, we have all those resources within the community that have really been great to come out and support us.
Okay. And let's see. Your staff, do you have any sickly employees that you've had to put on quarantine? And if so, how does that basically interfere with, if it does, the medical care that one might need there at the hospital?
So yes, we have. We've actually had some staff members that we've had to put on quarantine. It's because they were traveling. Pretty much. John was on quarantine, so he just came back today. Was his first day back. This is Karen.
Yeah.
I know. And so what we have done is, for that, remember I talked about we've kind of decreased our services. So if it's elective surgeries, we stopped that. So we have staff members that are looking for their hours because they're no longer pulling hours in those specific departments. So we really haven't had any to decrease our patient care, which has been nice, even with that. And it's been limited staff member. What happened was, when that decree came out, it was right before the spring break, and people had already taken off without knowing that this was going to affect them.
Sure. Okay, very good. Again, thank you so much. I think Mayor and Council, I would really like for our communications office to really work hand in hand with John and Twilight, even with language that we can share with our constituency about the social distancing, the washing, the idea of using curbside. We really need to reduce. I'm with Twilight in that I even just coming to the office, seeing Walmart and other larger stores with their parking lots full, it's really concerning to me. Or hearing on the weekends that people were in the park or at the river having a cookout. It's just not the best. They need to be social distancing, isolating themselves like we all are trying to do. So I think helping us with some language that we can share with our constituency around the social isolation, or the physical, I should say, distancing would be really helpful, because And along with Councilor Vasquez's point, I think, Mayor, it would be time to really place an emergency and remind folks about the governor's order, not to be outside only in those instances because you have no food, those kinds of things. So thank you. Thank you all.
Thank you.
You're welcome.
Thank you.
Okay, so I'm having some technical difficulties here, so I can't see if anyone is asking for a question. So I presume you do, Councilor?
Can you?
Councilor Flores?
Yes, thank you. Thank you, Mr. Mayor. So I totally agree. I agree with Councilor Vasquez's, he asked all the questions. He laid a very good foundation, asking all the questions that led up to my request, Mr. Mayor and fellow councilors, for you to issue an emergency, a state of emergency for the city, and require people to stay at home. And that would be an ordinance that perhaps would carry a misdemeanor and a fine. I know El Paso is doing that. I know that European countries are doing that. And first of all, I wanted to say thank you to all of you. It's just amazing the work that you're doing, and I salute you. And I'm glad you're back, Mr. Harris, and that you're out of quarantine. You're safe. I think that there's enough evidence here based on Twyla and Karen, and especially what Mary Armijo said, because we received a letter from a resident who was appalled about the behavior by some of the big box, I don't want to mention them by name, but big box that weren't, I mean, in my humble opinion, aren't totally essential. I mean, if somebody's plumbing has broken and they're trying to do their best to keep, to fix it, maybe, but then who's going to check that out? But certainly limiting the amount of people that go in. I know when I was at Sam's about 2 days after the order of the stay at home and, the schools closed down, I was at Sam's and there was a woman there with about 10, there were 10 kids and they were all about between the ages of 8 and 10. So she was obviously, well, not obviously, but my presumption based on that was that she was doing childcare. And they were helping her get things off the shelf and no, put that back, and they were touching everything. And I just left with my toilet paper. That's all I went for. So I feel very strongly that people are not paying attention. I know that Governor Cuomo, I know our own governor, but we see Cuomo more on CNN. He comes on and lets us know how and why New York, because of its density, population density. And now he had said earlier, about a week, some days ago, that he did not want to have confine people to home or have a lockdown. And I think he's considering it now because people are there. So based on everything that you all have said, I would urge and I hope my colleagues agree, that we need to declare a state of emergency in the city and then impose an ordinance, by ordinance, to keep people indoors, because we've been very fortunate that we don't have the numbers that other places have because of our, we don't have a dense population per se, but our city is the second largest. So we do face that risk here in Massachusetts. Oh, Twyla, I had a question for you. As far as the data intake for people who travel, who come in, so do you ask what the point of origin is, where they travel from, or do you go into that?
Yes, we do. Yes. Okay. Yes, we do. Mm-hmm.
Okay, and so if they're coming in from New York, do you take extra precautions and make sure that they have those?
Thank you for the question, but this is Twilight Anderson again. No, the PPE that we use is standard for every person coming in for the drive up for the testing.
Oh.
So we're in our full gowns, gloves, mask and shield, full face shield for everyone. We don't, just based on that history. Because, you know, somebody may not be telling us the truth. So we're going to treat everybody as possibly infectious.
Okay. And then do you do any tracking after they leave, or how does that really work? Did they come in, they do the drive-by or drive-through, excuse me, drive-through testing, and then they leave, and then what happens after that?
Sure. Good question. Thank you for following up on that. Since we are working with the Department of Health and the kits are provided through the Department of Health, once we collect, we send the specimens to the state lab, and then the results are fed back through the Department of Health, and then they have personnel calling everyone back with their results. So any positive is contacted immediately, then those negatives within a week to 10 days should receive a call back from the Department of Health, and they should get their results.
So these drive-through testees, do you recommend that they isolate, that they
Yes.
At home? And when they
Yes, we give them a little information sheet to stay home until they get their results, and from the Department of Health, and that they'll be notified with the results by the Department of Health.
Oh, thank you, Twilight, and thank you, everyone. The other thing I wanted to say is that I agree with Mayor Pro Tem Gandara, and I think other councilors too. I think we all feel very strongly that there should be more information that we as a city can provide, perhaps a mechanism, I don't know, whatever, to use our PIO, our Public Information Office, to disseminate more of this information. And also, it'd be great if maybe some of the stations in El Paso could come out here and do something. I know that there's a couple here who do have reporters, and they're our only news outlet. So we don't get the coverage that El Paso gets, and I think that we need that for our viewers, for people who don't have cable and hopefully do have a television set, and can then have access to what's really going out, what's really going on in the world, or in our community, or with COVID-19. So I hope that we're able to coordinate in that way. And again, I can't thank you enough for everything you do and for keeping our people safe. And please take care of yourselves, and blessings. Thank you.
So this is Karen Iverson. I was going to make a recommendation. For anybody that was around in 2009 when we had the massive flu that hit us back then, we did in El Paso area public service announcements, and they ran pretty much all day long, not only on TV, but on the radio for those individuals who don't have a TV or something, but at least it was something out there constantly that they could hear. So that may be something that the PIOs can work on through the city as well.
That's great, Karen, and it would have to be bilingual, especially the radio stations.
Yeah,
totally agree.
And they would have to be in all because I think there are a lot of stations, more so in El Paso than here, that have a lot of Spanish-speaking stations on AM and FM whatever.
Correct.
Anyway, thank you. Thank you very much. Be well.
Thank you. Thank you.
Okay, I think Councilor Vasquez and then Beta Stubbe.
Thank you, Mayor. And thank you again to the staff for taking the time to speak with us today and for being on the front line of this national health pandemic. I do have just two questions. One is, given the national trend, statewide trend, but the national trend of where this virus is taking us in terms of the infection rate, but also the mortality rate. I know Doña County has perhaps not experienced the jump in cases of infection that other parts of New Mexico has, that we've seen in Bernalillo County, Santa Fe County, and Taos County. And so I want to make sure that the public doesn't get a false sense of security in terms of this not being a big deal here in Las Cruces. And so with any degree of certainty that you have based on experiences nationally and statewide, how would you characterize perhaps where we might be in 2 weeks or we might be in a month, right? Because we don't want to give our residents a false sense of security that there's no problems here. And so what is the best case scenario given the information that you have today? And what is the worst case scenario given the information that you have today for a couple of weeks out from now in Las Cruces and Doña Ana County?
I'll add.
This is Twilight Anderson. This is a new virus. And so the behavior of this virus is something that we're, watching very closely, and how it really attacks the population as a whole. And as we test more and understand what our prevalence is in our state, in our region, in the, what El Paso, Texas, and New Mexico area, I don't think any of us can predict a best or worst scenario. The testing will drive our data, and our data will be evaluated. And, we're just taking this each day at a time and preparing for the worst and hoping for the best is what I can say.
Yeah, so this is Karen, and actually one of those things that we discussed this morning was if we had to predict what would it look like. And so if you follow the national trends and follow the trends from overseas, we talked about anywhere from a 2 to 3 week where we think we might peak. And that would be where we start to see the most of our cases, and then hopefully go on the downhill side of it. Doesn't mean we're right. It just means that that's based off of national trends.
Thank you. I appreciate your honesty, and I know the uncertainty and being able to predict it is probably unsettling, especially for medical professionals and science-based professionals. And so being able to be prepared for either of those scenarios, I think, is important. And so I do have one request for MMC staff that hopefully serves a mutual goal for both the city and for healthcare professionals and for our healthcare system here locally. And I think we touched on it here a little bit, but if you have policy recommendations that the city could be taking today, that could be taking this week in either best or worst case scenario, if you would be willing to outline those in a memo to the city of Las Cruces, I think that would be really helpful, especially for me as a member of this body, to make the adequate and recommended actions to protect our population coming from healthcare professionals would give me a lot more comfort than doing it based on national media or state media, but our folks here on the ground. And so I'm happy to hear that our city council, my fellow colleagues on the council, are willing to entertain this emergency proclamation to help stop those gatherings of folks that potentially pose the biggest concern to the spread of this disease, this virus. But if there are other recommendations that you might have for a local government that we could be taking now, or that the mayor could take, given his powers that are granted under an emergency proclamation, would love to see that. And also, I think that would give our community a lot of comfort in knowing that the decisions being made by the city are coming from the healthcare workers here in our community. So I'm not sure if that's something you'd be willing to or can put together, but something that I would love to see in terms of the decision making that we move making forward, coming from the folks who know this virus the best.
Yeah, this is Karen, and yes, we will work with you on getting that done. And I can tell you our providers and physicians in the community have been on board and trying to help us do the right things from day one. So I'm sure they have some recommendations as well.
Thank you so much. Thank you, Mayor. That's all for me right now.
Thank you. Before I get to Councilor Beta-Stuvey, if you don't mind, Councilor, I'm going to let Colin Combs, our OEM director, just jump in real quick because he's got another meeting he has to go to. Colin, you there?
Yes, sir. Can you hear me?
Yes. There you go.
All right, Mr. Mayor, Colin Combs, Emergency Manager for Doña Ana County in the city of Las Cruces. I think advice for the community.
I lost you there, Colin.
Okay. Can you hear me still?
Yes.
Yeah.
Okay, great. So your two questions about how to prepare for the surge and advice for the community, I'd like to kind of interject on that as well, sir.
Okay.
So everything that they have said has been absolutely correct. This is a a response being led by healthcare, and we've been operating under the auspices of the New Mexico Department of Health and following their direction and supporting their operation. We have, I guess, the luxury of being co-located with them for the Southwest region out of our office complex here, with us being with the New Mexico Department of Health, and we've been able to work with them on their planning for their mass testing and continue to support their operations. A lot of the information that was passed out today, I want to just put out a couple websites first. cv.nmhealth.org. All those recommendations that were given by MMC staff there are on that website. Also, if for general information about things going on within the state and whatnot and the impacts outside of just the preparedness efforts, you can go to newmexico.gov for any other information surrounding that. There's also 2 phone numbers that I want to provide. If you need advice on symptoms and whether you should get tested, call 1-855-660-3453. And then general information can be found at 1-833-551-0518. That information has also been provided to Udell and his staff. They've been great to work with. The website that you guys have put up has been really supportive of the Joint Information Center that we've established, where we're bringing all the PIOs throughout the region together to push out this information. So a lot of that information that was already discussed is on the city's website under the COVID-19 alert button. So as for what do we do to prepare for the surge, I'm going to restate it again. Wash your hands. And I know that sounds so simplistic, but these preparedness efforts are scientifically proven to stop the spread of it. 6 feet separation between person when out in public is critical for stopping also or helping stop the spread of the COVID. Gatherings of less than 5 have been ordered by the governor. And if you feel sick, stay home. If you are essential personnel, stay home if you feel sick. And again, it's that 14 to 21 day quarantine, which is going to help stop the spread. So that's kind of like my start off for what we can be doing to help prepare for a surge, is following the current advice that has already been provided to us. And that would be my advice to the community. The Office of Emergency Management has been in contact with the state of New Mexico daily. The state EOC, we are working through Emergency Operations Center, and being able to get updates. We have been provided deliveries from the Strategic National Stockpile for PPE, and as those have been coming into us, we've been providing them to our first responding community. The call that you mentioned, sir, every once a week, we're getting on with all of our first response agencies within our jurisdiction to get updates from them, from fire, law enforcement, and EMS, to see what their needs are and where they're at with their level of PPE, personal protective equipment, and trying to work through the different issues that are there, and just giving us a posture of readiness as much as we can have with this. So that's kind of how I would answer those first 2 questions that you posed to MMC, but I want to see if there's other specific items that I can research or help find for our council, for yourself, sir.
Thanks, Colin. One of the things I think I mentioned to you, and if you want to give us an update, is if we needed to access the armory that we've had in the past, that's still available. Is that correct?
Well, so the Corps of Engineers did a survey of it last week for a expeditious hospital that could possibly be stood up. And then also, I think we would have to engage with the owner of that service, since that lease has passed, for standing it up if the city wanted to take any specific actions. But that was one of the areas also the state just did a survey of for one of the, I don't want to use the word makeshift, but quickly established alternate care sites.
Okay, if you wouldn't mind just to be on standby, just to get with the owner, just in the event we need it. So
Yes, sir.
we'll be ready to roll.
I'll make contact with him today on that.
Okay, great.
Yep.
Okay, so getting back to Councilor Baker-Stubbe. Thank you, Colin. If there's nothing, unless there's any other questions from council, I know you've got a meeting you got to go to. I don't see any, so.
Does, sorry, Mayor, does
Yes.
Intercoms have just about an extra minute or two?
Yeah, yes, ma'am, please. I want to.
Thank you. Thank you so much for being here. MMC, they just talked about criteria that is needed to be able to access a test. And I was going to talk to you a little bit about what does our supply of test kits look like down here? How many do we currently have available in Las Cruces?
So, ma'am, that is being handled by the Department of Health. And I'm not trying to put off your question, but I would have to work with them to find out the number of tests that would be available.
So they have, I'm sure that they have different spreadsheets and supply lists available, information then that we can get.
Yeah, I believe that would be the case. I can contact them. And I can tell you, I mean, currently, right before I came into this meeting, they are performing tests in this area as they're doing their surveillance too.
I think it'd be very important for us to know how many residents have been tested, how many test kits that we do have available as well. And if we're looking at that sort of thing, also, since the governor has asked for the supply list for PPEs, what our stock is in Las Cruces for what those numbers look like for here.
Yes, ma'am. We have a rolling stock that we're tracking and working with all our agencies on that. So your questions are test availability of kits in the community here. How many have been performed?
And how many are currently available in our city right now?
Okay.
And then how long is it taking? They said notification if you test negative is around, they were saying about 5 to 7 days. If someone tests positive, how fast are the hospitals getting that information so they know how to treat appropriately?
And that's getting into HIPAA, so I would defer that question back to New Mexico Department of Health.
Well, okay, that's just, are the hospitals getting notified at an appropriate time? And
Twyla that was on the phone, if she's still there, she can maybe speak to that a little bit more, but I know her and the epidemiologist for the region are talking on a frequent basis.
Okay, and so they're getting that information as soon as possible in order to be able to treat their patients to the best possible ability.
Twyla, I feel like I would be stepping outside of my realm and into yours. Would you want to speak to that, ma'am?
Sure, this is Twilight Anderson. Yes, as soon as they have a positive, where the test originated from is notified. So that communication has actually been going on nearly around the clock. So when we had our drive up, the positives that we had, we were communicated with immediately.
Oh, fantastic.
So Tessa, this is Karen Iverson. If we send everything up to the SLD, which is a state lab, we get that, if they pick up by Thursday, we get those with about 72 hours. If they don't, then there's between Thursday and Monday morning, there's no courier service that takes the test back up to them. So we have been using LabCorp, and LabCorp actually takes longer than the SLD, which is about, what, 7 to 10 days. So we did talk to the state this morning and asked if they could extend their courier service to cover the 7 days instead of just 4 days. And we're waiting on that response.
You know, in
this is John Harris. But let me just say, this is John Harris. Let me just say though, the longer that it takes to get the results of a test, the longer we have to continue treating you as a COVID-19 patient. And the more PPE, personal protection equipment, that we have to use, that, as we all know, is in short supply. And we have the benefit of someone that just walked into the room, and that is Dr. Dolores Gomez, who's our chief medical officer, who can tell you, as a practicing clinician, what this means.
It's not good. So just to put it bluntly. I mean, it's really hard, and if we're getting pushback and being able to move these patients to other facilities, and we're already starting to hear they don't want those patients until they have a positive or a negative test result, it's going to put a burden. And if we get a surge and we're having patients sitting here waiting for results, that could be extremely detrimental to patients coming in.
Yeah. Thank you for answering it. That's been a concern of mine, and I had mentioned it when we first talked to DOH a few weeks ago, is how long it would take us to get results. And, you know, for me, you know, even 72 hours seems long, especially if we get into the thick of things. And so I'm not sure what type of conversation that is to have with the DOH, but I think it's something that we really need to look at and see how can we get more expedited, accurate results for you all, so that we can make sure to keep that flow and that pattern moving to get everybody where they need to be to get that excellent care of health.
This is John Harris again. I was going to mention this earlier, but my team that is around this table today will attest to the fact that we have had really good cooperation from the governor's office, from Secretary Kunkel's office, from Secretary Scrace's office. They are really doing everything they can to help us out. But this is a novel situation. This is unprecedented, and we are working through the difficulties of you know, we're learning where the weaknesses are in the continuum of care. I mean, you can only imagine today it was announced that Abbott came out with a test that Dr. Gomez, for example, our chief medical officer, could see you in her clinic and could diagnose and verify COVID-19 if you had it within 5 minutes with the Abbott test. There's another one that is out there that could be done within 45 minutes. Either of those are far better in the context of what we've talked about than 3 or 4 days. Some hospitals in the state have suffered from getting results for 12 days. So hopefully these things will be approved. When I talk to Karen, I talk to Twilight and Dr. Gomez, they will say, well, it will be the fall before we have the availability of the Abbott test, because the priorities of New York and other high prevalence areas, as Twilight stated it earlier.
Thank you for that. One of the other questions that I had, since our criteria for testing still includes travel, that I assume means that we do not have detection of community spread here in Las Cruces?
The Department of Health is looking at that. So far, I haven't heard a confirmation of community spread here in Las Cruces at this time, but they are doing the case follow-up, and so that may be coming a little bit later to us.
And do we need to be concerned, perhaps, and I don't know this is why I'm asking, but do we need to be concerned that if we have that as a criteria and we don't test somebody, that we might be missing community spread, or do we think we're still in a good place right now?
This is Twilight again. I think right now we're in a good place. Our numbers seem to be low, but we need to continue with all of those prevention strategies that we've already talked about.
Yeah, this is Cullen Combs again, ma'am. So all the concerns that have been expressed about people not following the precautions outlined is how community spread will happen. Mm-hmm. So that is why this is being put so much. And it's crawling at the walls right now, but we're all hunkered down. I'm the only one who's going outside the house to just help with this right now. Mm-hmm. Everyone else is trying to do their part by staying home and trying to stay healthy. So.
Absolutely. I think it'll be important for our community to adhere to those guidelines, and I just want to make sure that we are not perhaps missing, everybody has that false sense that it looks fine outside, we don't have that many cases, but I want to make sure that we're not missing it because of the criteria.
Yes, ma'am.
We have it for the travel still, but if we have community spread, that we're not missing that. although I would be very happy if we could only stay at the cases that we have now and not have, and really make everything much better. And my final question, and thank you so much for letting me answer all these, but we talked really about the cafeteria for MMC. You have night shift too. Is it available during night shift, or are there opportunities for assistance for your night shift crew for food?
This is Ryan Perkins, and yes, we have two different times that they're open. One over the lunch, one over the kind of the evening period, so that way they can grab lunch both times. So yes, we absolutely do that.
Fantastic, and thank you all, and thank you, Mayor.
Before I get to there's a couple more rounds of council members want to ask you questions. Before you, I know you guys have to leave, so let me just ask you just a couple things real quick. One, as far as, did I hear you, John, or somebody say you needed some drivers, or that was something there that you could use some assistance to run the lab results up to Albuquerque?
This is John Harris, and that was Karen that made that remark, so I'll let her comment on that.
Right, so we reached out to Dr. Sanzone up in, at the Department of Health in Albuquerque, and currently they have courier service from Monday through Thursday. And they did not have the capability to do from Thursday afternoon on until Monday morning again. So I texted her this morning. I have not heard back from her yet to see if we could extend that to 7 days a week.
Well, I just want you to know that City of Las Cruces is more than happy to help pay for that. And we can, that's something there that I believe we could probably handle, cover. So that's one thing.
Okay.
Second, as far as blocks of rooms, would you need those for maybe isolation of patients possibly, and or workers, in case they might think that they might feel comfortable going there instead of going back home if they need to just, maybe they feel that they may have been infected of some sort and might feel better doing that. We can also help with that as well, I believe.
So this is Karen, and we've actually had the retreat that's out, Holy Cross Retreat, who's offered us their space. So far, I have not had any staff that has taken us up on that offer. We have put it out there, but if anything changes, we will definitely let you know.
Okay, and then the last is, one of my colleagues, I can't remember which one, said something, and I think I know which one. She works quite a bit around the clock. She doesn't watch much TV, but said something about El Paso stations, or the stations in El Paso don't cover Las Cruces as well as they do in El Paso. I just want to just say KVIA TV Channel 7 does a fantastic job. They have a dedicated staff, 2 members, Kate Berry and Tom Scott, who provide information nonstop every day. So I just wanted to point that out. So, okay, now getting back to Mayor Pro Tem Gandara, then Councilor Vasquez, and then Councilor Sawyer.
Hi, Mr. Thank you so much for being here. I'll try not to take too much time. I appreciate all your efforts round the clock. I know that's what it's taking, right, to make sure that we're all safe. I was presented the PowerPoint presentation that you had given. I know you wanted to give it to us, but was unable to. You probably were doubled up with meetings that Monday evening. And I noticed that for our EMS, for our preparedness, that you're having these weekly meetings, and they're consisting mostly of health personnel, our PIOs, our Department of Health. But I was interested in to see if there was opportunities for our nonprofits, those that are helping with our either our elderly or our children and families on mental health. If there's opportunity that for them to participate in these weekly meetings, and or a different type of meeting to include our faith-based organizations.
Sure. Well, and I will tell you, from our previous emergency last spring, I've developed a lot of relationships within that realm. I've been working with Miss Frida Adams on the faith-based aspects of just getting updates to her She has a weekly, actually now Zoom meeting. And so we're providing updates to them as well. I know that another one of our volunteers who's a dedicated emergency manager, done this for a number of years, has been engaged on the homeless issue and also that kind of side of issues as well. If you have a suggestion, I can work through David Askest to set up if there's a need for information. I've been talking with also Community of Hope on trying to field questions from them. So we've had a pulse on that, but if you feel like there's a more structured item on that, I'm more than willing to entertain it, as long as obviously, we can put it in the schedule. So
Sure. No, I understand that. I know how busy you must be, but I don't want there to feel like there's a gap as it relates to that particular cohort of folks, for sure. So I will send offline that information, names and contact information.
Yes, ma'am. We could possibly arrange something if they feel like after getting their feedback, if that would be helpful to them. I'd love to serve them in that way.
Thank you so much.
Because I will tell you too, I mean, public, yes, we're the government, we can do all these great things, but it's really the private entities within our city that provide a lot of great services that we don't even touch. So
you're absolutely correct. So thank you so much.
Okay, thank you, Mayor Pro Tem. Councilor Vasquez.
Thank you, Mayor. Yes, I understand Mr. Combs perhaps has to go soon, so I did want to ask him a few questions. Maybe I'm a little bit unclear as far as what the role is. I know it changes from every emergency situation that we find ourselves in. But, in terms of what the role of Mr. Combs is in this particular situation and how he can best help the city, I would like to know that, because I know I got a lot of information from Mr. Combs in his last statement about what the state is doing, which is the information that's being put out by the Department of Health and the governor. But how can Mr. Combs, how can you help the city in particular to actually localize a response to this situation? How can the city council best utilize you and your team at this point so we can make the informed decisions we need to protect our constituents?
Sure. So first, the construct of the planning for this type of event of a pandemic is a state-driven initiative, if you will. So the New Mexico Department of Health is designated as a lead agency for this, and we've been trying to find out what their needs are to support them locally. So, you saw the mass testing that happened, 2 weeks ago now. My team was involved in the planning and helping execute that. I mean, we were out there doing traffic direction but then also on the backside of it, doing the planning and whatnot. I've been communicating on a frequent basis with Mr. Maestas, your acting city manager right now, and finding out what the needs are. And then also Udell and his team on the communication staff, we've been working through the Joint Information Center to provide information and also to get feedback from them as far as what the needs are. So those are the conduits that I've been working with, along with communicating with Chief Enriquez and Chief Gallagher on a pretty frequent basis as well to find out what's going on in the city. And so those are the lines of effort that we have that's supporting the local, obviously, city of Las Cruces, and then thinking about our some of our smaller communities too, within a whole community concept of reaching out to them as well. I know that there's been some informational videos being created also by local leaders to, again, emphasize those important safety measures that need to be in place for people to do that. And I really appreciate the mayor stepping up and doing that, along with Mr. Macias at the county level. And we're getting some BOCC members. And I think I don't know if the council has been contacted about that, but just doing kind of like little PSAs to, again, just hammer home those very basic but very extremely important safety measures. Does that answer your question, sir?
I think to some degree, yes. And I'm wondering if there's like a written report that you put together. Certainly appreciate all your work, but I can say that it doesn't trickle down to me. And so not understanding what the role is, especially as somebody who is tasked with getting information out to my constituents, not being able to have that information is a little bit troubling for me. And so how do you have a written report or some other way that
yes, sir.
I can get an idea of what your office is doing?
our daily Joint Information Center call. The notes should be going out to all elected officials. Are you receiving those or?
Nope.
Okay, I'll follow up with the CHIP director and see if she can get those to the city council. Actually, I'm sorry, Mr. Maestas. Are you on, sir?
Yes, I am.
David?
Yeah, have you received those yet from Kelly?
Yes, sir. Thank you, Mr.
Okay.
Combs. Mr. Mayor, Councilor Vasquez, at the last county commission meeting, county commissioners asked Colin the same information. They said, can we see a copy of the minutes? Are we allowed to be involved through that method to see what takes place in your Joint Information Center meetings? And so we talked amongst ourselves as part of the group for the Joint Information Center, and we said, yes, that would be viable. I just received the first group of minutes from Ms. Jameson this last week, and I will be disseminating that to council here within the next day or two.
Thank you. Thank you, Mr. Maestas, and thank you, Mr. Combs. I appreciate that. And the reason I ask these questions is because as policymakers, but also as folks who are stewards of the taxpayer coffers, when we are prepared to enact a local response to an emergency in our community, having the most information possible to invest taxpayer dollars into such an effort is really important. And so I know we all have ideas of how we can respond in these times, but without having the information, perhaps from the state, from your office, and another reason I asked the folks, our healthcare professionals in our community, to provide a memo. We're not, I don't believe we're adequately informed to be able to respond to our community in the way that we want to. And we're talking about big dollars. We're talking about millions of dollars potentially that we want flowing back into the city of Las Cruces to help those most impacted. And so thank you, Interim Manager Maestas, and thank you, Mr. Combs, for understanding that that information really, in my opinion, needs to come down to the folks who are making these decisions. And so be appreciated to be getting those reports moving forward and understanding the situation as complex as it is so that we can invest taxpayer dollars if needed appropriately and adequately. So thank you so much. Thank you, Mayor.
Yep. And obviously too, if you guys have individual questions, please shoot them through Mr. Maestas, because we talk on a frequent basis, and that way we can start to get that information flowing faster to you. So I would appreciate that.
Okay, thank you. Thank you, Councilor Vasquez. Thank you, Colin. One last question, I think, is from Councilor Sword.
Excuse me. Thank you, Mr. Mayor. And thank you, Mr. Combs, for all that information. This question is for John and his Memorial Medical staff. I understand that from what we're saying today that we cannot read any of the coronavirus tests here in Las Cruces to determine their output, right?
That's correct.
That would help, wouldn't that? Would you confirm the fact that that really help us understand and help curb some of the spread of the coronavirus here?
This is John Harris. Absolutely, that's true. The faster that we can, when necessary, test you based on your symptoms, and the sooner that we can get the results of that test, it does many positive things, including what you just stated, Councilman, and that is reducing the spread of this disease, this virus.
Okay, thank you so much. Do we have enough tests right now at the moment?
Do we have enough? I'll let Twilight answer that.
Sure. This is Twilight Anderson. Currently, for the demand of the amount of people showing up for testing, we do have an adequate number of tests, and the state has been working really hard to keep us with test kits. And so I'm going to tell you today, we have enough test kits for the individuals who showed up for testing today. Tomorrow's a new day, okay?
Yes,
so,
yes, of course. Yes, I understand. Okay, I know we can't predict the future very well here. Well, thank you all very much. I've got a lot of good information of everybody who was talking today and answering questions. So carry on, and I wish you all the best. Thank you, Mayor.
Okay, well, thank you, Councilor, and John, and Karen, Mary, Ryan, Twyla. This has been phenomenal. We appreciate you and being able to share your almost 2 hours with us for a very, very important topic, of course. And so thank you please convey on behalf of the City Council, myself, to all your staff for the true hard work that they do. They're real heroes of our community, and we couldn't thank them enough, keeping everyone safe and healthy, and just, just being real troopers. I mean, I don't know what else to say. Just thank you.
Well, this is John Harris. I just want to say how much we appreciate you and your leadership and the city council's leadership. We sincerely thank each of you for who you are and what you do. You are great partners to us, and we really, really appreciate you. Thank you.
Thanks. Thank you. Oh, you're welcome to sit in the rest of the comments. We're probably going to go now to city council, but I know you guys have other meetings you have to do and get prepared for later.
John can stay.
Thank you. We'll sign off. Thank you, Mayor.
Okay. All right.
Thank
Mr.
you.
Mayor, Colin Jones here. Thank you very much, sir.
Thank you, Colin.
Yes,
Careful.
sir.
Thank you again, sir. All right, so now we're getting back to the ideas and the council had presented. So this looks like Councilor Short. Did you either forget to take your little hand off or you have a question?
Yes, I forgot to put my hand down. I thought it went automatically. Apparently not, huh?
Okay, so it looks like Councilor Vasquez.
Automatically. I didn't even do that.
Okay. All right, then we'll go to Councilor Vasquez and then Councilor Flores.
Thank you, Mayor. Thank you. So I'm not sure.
Mayor, I think we have quorum now, so whenever you want to start, it's up to you.
You can't hear me? Okay, so it's 3:45 p.m.
Hear you now.
Okay, good. And we had some technical difficulties there, so we'll turn it over to Councilor Sword. Councilor Sword?
Is my microphone working?
I can hear you, yes.
Okay. No, I don't need to be taken over. Proceed with the meeting yourself.
Okay, let's see here. Well, who's next? Because my computer's still off. Fortunately, I have my iPad on.
Mayor, I was going to propose a couple of different
Okay,
things
yes,
here.
go ahead.
Sure, no problem. And I could either wait until Councilor Gandara and Flores get here, if that seems more appropriate, to make sure that they're fully informed of what we're proposing.
Sure.
Okay, I'm happy to then just wait until they get here to get their thoughts on it.
Well, you can go ahead and read until they get there. You can go ahead and just talk a little bit about what it was.
Okay, sure. And I'm hoping that Mr. Maestas can send out the email that includes the information that I'll be talking about here, which we would have passed out if we were there in person. And so we did have some thoughts, Mayor, following up on your proposal on the best way that our community could respond to the needs given this crisis. And so, from my perspective, I think from Councilor Bencomo and Abeta Stuvi's perspective, don't want to speak for them, but I know we talked about this quite a bit, is we want to maximize the opportunity to help people in this situation, especially those who find themselves in situations of hardship due to loss of employment or reduced income as a result of the global health crisis and how it's impacting us here locally. And so we do know that the Community Foundation of Southern New Mexico has stepped up again in a big way to create the Together Las Cruces Fund, which provides, my understanding is, twice monthly cash vouchers ranging from $250 to $250 for the recently unemployed, self-employed, and those who have otherwise been financially impacted by the crisis. And so I did want to offer the opportunity for the city to provide funds to that particular program hosted by the Community Foundation of Southern New Mexico at a cost of $1.5 million over the 3 months. And so that would be a monthly allocation of $500,000. These funds are available to anybody in the community who follows anybody in the community who is eligible to receive these funds and applies, including undocumented workers, including workers in mixed status families. And so thinking that this probably should be the city's biggest expenditure is figuring out a way to help people first. And so that's part of our proposal. And that would be something similar to what we did with the asylum seeker situation when we had that in our community, under which the Community Foundation of Southern New Mexico would administer this grant, and eligible folks would apply through the Community Foundation of Southern New Mexico, and also would hopefully alleviate any state anti-donation clause issues related to that, in terms of how we were able to help asylum seekers as well. So that's one of the ideas that we proposed. Do have some other proposals here, but I do want to let Councilors Abeta Stuvi and Councilors Bencomo also comment on those. So I will let them comment on the other parts of this proposal. The only other thing I will add is the Utility Assistance Fund that we do have with Casa de Peregrinos would also propose a $100,000 increase into that fund. Our annual budget for that fund is $100,000, and understand there's been obviously a greater need for that in this particular situation. And so being able to double that fund in this time of need, I think is something that we want to put forward, and in the amount of $100,000. And so with that, I will let Councilors Bencomo and Abeta Stuvi comment on the local restaurant and small business relief fund, the rent and mortgage relief fund, and a social work, hunger, and homeless relief funds, if they would like. Otherwise, I'm happy to comment on those as well, but want to give the opportunity to them to comment.
Okay, thank you, Counselor. It looks like Beta Stuvi has a question, but before I get to her, I'm going to ask if Jennifer, if she, City Attorney Vega Brown, had heard your proposal or your suggestion. Let me just tell you, I like it. I don't know if we can do directly to a foundation because obviously there's that anti-donation comes into effect. The reason why I think we were able to do with the asylum seekers is because one of the exceptions was indigent or sick, and so these are people who just hit the United States. We knew they were indigent and could qualify under that, but I don't know. I'm going to have to see if she can jump on, or we may have to just because I don't see her as a participant, but I texted her and I know she's there. So Jennifer, are you able to join the meeting?
Yes, I'm here. Can you hear me?
Oh, okay. Okay, there you are. Okay.
Mayor and Council, Mayor, you're correct. It's a different situation than the asylum seekers. It seems to be very different because the asylum seekers were arriving as indigent. They did not have any assets. They didn't have any belongings. Their health was in danger. And so because they were indigent and because we were providing necessary items for their health and well-being, that certainly does fall outside of anti-donation. The giving of money directly to businesses is arguably would be a problem with anti-donation.
I'm sorry, Attorney Vega Brown, I don't think we're talking yet about the businesses. In fact, our proposal doesn't have any money going directly to businesses at all. I think we're discussing right now the Community Foundation Together Las Cruces Fund that currently is dispersing $250 to $500 to individuals impacted economically by the situation. So either through loss of employment or loss of income. I think that's the first item that we propose.
Okay.
So far, yes, ma'am.
You had mentioned small business development or community development, which has to do with some small business. So I'm sorry if I misunderstood you. But
that's okay.
In addition to that, so indigency has to be established. We don't have currently an indigency program, so we would have to make sure that that money is going to indigent services directly. We can't do what the state does, and they provide entitlements. We don't have that type of program. We could always create that type of program, but that's something that has to be very carefully considered. We can only provide direct services to.
So, Ms. Vega Brown, thank you for that. I appreciate that. I think in the determination that the Community Foundation of Southern New Mexico would make to make these funds available to local individuals in our community as well as families, they ask a series of 10 questions that determines that they are in a financial hardship due to this particular situation. And so, in the sense that these are needy families in the city who need immediate assistance to pay rent, to get groceries, to have formula for kids, all those things that many of us take for granted, but these families and individuals find themselves in these situations without financial support to get these things. Is that series of 10 questions that the Community Foundation of Southern New Mexico makes eligible or uses to make people eligible, would that not be considered serving an indigent population through that particular form? And also part of the plan with this fund is to be able to serve the undocumented population in the city. or those with mixed status families in their households who currently don't qualify for any of the federal financial assistance under the latest legislation passed, who I would argue are also indigent populations. So legally, would those folks through that qualification process be eligible to receive or be able to qualify as indigent?
I don't know, Mayor and Council, we would have to look. There are several definitions that are contained in New Mexico state statutes that define indigency. One of them is the Healthcare Act. It defines what hospitals can consider as an indigent individual. There are other statutes where indigency is defined. For example, when you're receiving a public defender assistance, indigency is defined. There's a formula, and it has to do with several things: assets, income, availability of funds. There's an application process. Those are two examples that I could have. We could look further to see if it's further defined. Those are the only places that I have found recently that define indigency, but it's not just hardship. It's an actual term of art.
Thank you, Ms. Vega Brown. Well, I certainly would like to explore the boundaries of, legality when it comes to this particular situation, because the way I look at it is, I think we have an obligation to help those people who have been displaced economically by this situation. If not us, right? I don't know who else can provide those services apart from private individuals, and so would want us to explore that option fully. I know Tara Van Winter, the executive director at Community Foundation of Southern New Mexico, would be on standby, be ready to answer any questions, including maybe even going through a process that defines individuals as indigent in order for them to receive the financial assistance that they need to be able to provide the necessities to feed their family, to keep the lights on, and to be able to get to a grocery store, right, with gas money or transportation needs. And so I think that's really, really important for the city to step up in that regard. I won't comment much further other than to say that the small business and assistance plan that we did want to put forward also does not involve giving money directly to any particular business, nor does it involve putting out an RFP for services, but actually involves giving a series of vouchers to community members and having small businesses sign up for a small business relief fund list that the city can then have that would be participating members. Things like, businesses such as barbershops, certainly restaurants, others who have been forced to close down or offer limited services would be eligible if they signed up for the small business city relief fund. And then those essential workers who are out there still working today, including healthcare workers, law enforcement, firefighters, grocery store clerks, those folks would all be able to spend an amount of money at any of those qualifying businesses. And so that would open it up potentially as more of a free market opportunity, where the city's not choosing to contract with a particular business for goods, but rather is giving individuals in our community a free market opportunity to be able to select what business they want to patronize that has been affected by this economic downturn. I will leave it at that before giving the microphone to one of my colleagues. But if Mr. Maestas or Ms. Vega Brown, if we can send out that document to the rest of the council, that would be great, just so they have that in front of them. So thank you, Mayor.
Mayor and Council, if I may, again, the anti-donation clause prohibits any kind of private benefit. So that would certainly fall underneath that realm. And giving any voucher is a private benefit. In addition to that, I think we should be very careful when you're talking about providing any extra income to first responders, especially those that are employed by the city of Las Cruces, because now you run into IRS problems where it is a taxable benefit. So we should be very careful in weighing what the advantage of that would be. I have talked to our director of finance and to ask those questions, and she did provide some IRS information. some of those employees, if they do receive a voucher, would have to claim it as a taxable benefit.
Thank you. Those are great considerations. I appreciate you looking into that. The spirit, I think, of what we're trying to do is make sure that we can help restart our local small business economy, or at least keep it afloat as much as possible, given the legalities that that we have to face, and the the tough task of keeping our city running and keeping GRT coming into the city during this time. And so, without benefiting one particular or two particular, or even a dozen businesses, when there's so many others out there that are facing very uncertain times and doing that in a fair way. So thank you, Ms. Vega Brown. Appreciate your comments. And that's it for me for right now. Thank you, Mayor.
Thank you, Councilor. Just a couple things, and I know we can't do this right away, but this is something there that I've always thought that if we could get the legislature to allow a constitutional amendment to be voted on, that when the governor declares an emergency, that the anti-donation clause goes dormant to do these things. Because I'm running into the same thing, Councilor, but perhaps we might be able to work with Casa de Peregrinos or Community of Hope. They have a certain clientele that I think can be identified, and if we were to probably work with them, we might be able to accomplish many of the things you're talking about. Perhaps that might be an option. So we'll let staff work on that.
Thank you, Mayor.
Now, did Councilor Abeta Stuvey, did you want to talk? Because you had your hand up, and then I jumped in, and I don't.
Yes, sir.
Oh, you did?
Yes,
okay.
I was just going to add another section that we did have outlined, and it would have been for Domestic Violence and Child Abuse Relief Fund. And we were thinking that about a $200,000 to nonprofits that serve individuals and families impacted by domestic violence and child abuse. Items such as like La Casa and La Piñon are at capacity. And given the fact that now we have school is out for an even longer time, it is stressful times for many families and individuals, and they are going to probably continue to see that surge. So it is definitely a health issue in my eyes too, and to make sure that we can give resources to house and these victims if they are experiencing domestic violence or trauma in the home. And then this fund hopefully could help them provide resources, housing, clothing, toiletries, and other necessities. Given with the anti-donation issues, Attorney Vega Brown, is this something that would hopefully fall under the health guidelines that for Telstra Fund? Is there a way to work with this? Thanks.
Mayor and Council, first of all, the resolution that is currently in place, which is, I think we have a resolution in May for the Telstra Fund, but the original resolution, which is Resolution 05-128, that would need to be rescinded in order for you to begin allocating money that is not for healthcare. Currently, that fund is designated as for healthcare. You can change that, but it needs to be done by resolution. Secondly, there are several nonprofit agencies that the city partners with and enters into MOUs to provide funding because they do provide direct services to the indigent and for healthcare. Just remember, it doesn't have to be indigent and healthcare. And the organization that you just mentioned is one that we currently have an agreement with. They already provide those services, so it would be probably easier. I would have to look at their current MOU. I know I've signed several. We enter in many every year. So to expand our current MOUs with those agencies that are already providing those types of services would probably be a little bit easier than creating something from scratch because they're already providing the services. So I've asked, and I think Mr. Dallahan is already looking into what agencies we work with. We haven't received a list of those yet, but that is something that we have been looking into.
Yeah, so we could actually give monies to, say, La Casa La Piñon, and then they could go out and get additional hotel rooms. Would that be something that they needed to? Jennifer?
Mayor and council, yes, as long as that funding is providing a direct service, yes, we cannot pay for their overhead or their other expenses. We can pay for their direct service.
Okay, good. Great. Anything else, Councilor Abeta Stuvey?
No, but I believe perhaps Councilor Bencomo might be finishing it.
Yeah, she's been trying to get on, and so I'm going to go to her, and then I'm going to start down the list of the line. So, Councilor Bencomo? She was having difficulties. Maybe she's going.
Sorry, can you hear me?
Yeah, there you go.
Hi, everyone. Sorry, I'm a little frustrated right now. I've been off because of technical difficulties this whole time, so I missed basically everything that Councilor Vasquez presented and what Attorney Vega Brown might have mentioned. But I think I just want to reiterate that, we just heard from medical experts on the realities of this virus and that social distancing is the best prevention, meaning that people need to stay home, meaning that businesses have closed, meaning that people have stopped working in direct relation to the virus. So make perhaps already vulnerable families even more vulnerable. People who were right on that edge now are vulnerable. And the government, the federal government has said, yes, you will get a one-time payment that may or may not cover everybody's expenses, right? Families of 3, 4, 5 kids, right? A one-time, maybe $1,200 check may or may not cover their expenses for who the heck knows how long at this point, 1 month, 2 months, 3 months. And frankly, the federal government has failed a lot of people in this moment of need. And how will we stand up for those folks? How will we stand up with those families? I think I'm feeling really frustrated that that I keep hearing, no, we can't do that. I get that I'm new and I get that I don't understand a lot of these things yet, but in a moment of crisis where we're telling people to stay home, I keep hearing, no, we can't do that. That's really frustrating. And so I want us to be able to think creatively, obviously within the realms of legality, but we have to be able to support families in this moment. There was families that also got left out of that federal relief package. Undocumented families, people who were mixed status, they got left out of that relief package. And right now, people are, if they're not struggling right now, they're going to be very soon. And that's going to be the second outbreak, if you will. First is the virus, and then it's what that virus is doing. So I might not necessarily have a question, but I guess Attorney Vega Brown, I don't know, I didn't hear your answer about who is indigent and who isn't. So I'm sorry if I'm asking a question that had already been asked. But are people who have lost their jobs and their incomes in direct relation to this virus not indigent?
And Mayor, I said was that we need to look at current staff.
Jennifer, we're not really catching you too well. Can you get closer to the mic, please?
Sir, can you hear me now?
Yes.
Okay. What I said before was that we need to look at how our statutes define indigency and how we have previously defined indigency as an organization. We have to look at some of our previous resolutions that might have that definition in it, but we have to be very careful in how we define it because we don't want to change we can't change history at this point and open it up in the future. So we have to be very clear on what the definition is. As I said previously, it's a term of art, so we need to make sure that there's a legal definition for it and we're not creating something new.
Okay. Okay, on that note, we have currently a utility assistance fund, right? Where Casa de Peregrinos partners with the city to help support families in need of paying their utility bill. Right?
I'll defer to the city manager on that.
I believe we do, Councilor Bencomo. I think we set aside $100,000 for that, but I'm not 100% certain with the exact amount. And I think one of the comments that Councilor Vasquez was talking about is perhaps adding more to that, because usually in the past that has been exhausted pretty easily, pretty frequently. Were you wanting to know if that's something that we can do and possibly add more money into that fund?
Two things, yes, add more money into the fund, since we know that Dr. Garcia even himself recommended that if we were going to help the utilities department at all, it'd be through this fund. I sit on the utilities board, and the $100,000 will be exhausted at the rate that it's been going. It will be exhausted, and I imagine that even more so now. So I think expanding it is important. But, and Attorney Vega-Brown just said, let's not create something new. And so if this fund is already in place and we are able to provide that support, then how do we use this same model to provide rental assistance or assistance with mortgage? And I see Councilor Vasquez shaking his head. I don't know if I'm repeating everything you just said, so I apologize. But I want to just make sure I get that out there, because I myself, as a new counselor, am trying to understand these processes. And so if we have a utility assistance fund, why can we not have a fund for rent relief or mortgage relief during a period of crisis?
Very good question. I don't know if it has anything to do with the fact that it's our own utility, but we'll let, I don't know if Dr. Garcia is on the meeting or not, but if not, I don't know if anyone else can answer, but we definitely can find out an answer to that.
Mayor, if I could, and Councilor Bencomo, David Maestas here, interim city manager. I think earlier I heard Ms. Vega-Brown mention that we do have to look at specifics with respect to the wording. And then you also mentioned, Councilor Bencomo, yourself, about thinking differently, coming up with options outside of that. And this definitely is one area where, yes, we can look at how were we able to put this in place? Was it because it is a rate-based service? And if that's the case, well, then that might be a little different. But ultimately, bottom line is, yes, we can look into how is this put in place, and if it was, how can we model something that keeps us within our legal realms of not violating anti-donation, but coming up with a creative way of assisting. Thank you.
Okay, thanks, Dave. Councilor Ben.
Yeah, no, that's all I have for now. Thank you.
Okay, so after Councilor Flores. Councilor Flores?
No. I don't have anything to say.
Oh, you okay. Mayor Pro Tem Gondara?
Thank you, Mayor. As I said on Friday, I've done a lot of research, spoken to a lot of people in the nonprofit world, the state, to include CYFD Protective Services. So I thank the three counselors, Tessa Abeta-Stuvi and Councilor Bencomo and Councilor Vasquez, for mentioning the social services and fund. I think that's really important. And so currently, La Casa is at capacity. There is at least 36 women and children in local hotels. And so I would like to suggest that we give $15,000 to pay for the rental of hotels, food prep, and delivery. I also thought that maybe our county commission can offset some of that cost at 50%. I'm not sure, Mayor, if you've had communications with the county commission or County Manager Macias as it relates to that. I also spoke to the regional manager for the Southwest Quadrant of the state for Children, Youth, and Families Department, Cecilia Rosales. They're really in desperate need, especially, as I mentioned on Friday, Community Action Agency, all the families and children that are in need of diapers, formula, wipes, antibacterial wipes, those kinds of things that every large organization is having major problems retrieving or buying because of the limits and because of the hoarding that has really taken place. I think people are going back and forth to the grocery stores and collecting or buying these items, which is making it extremely difficult for our organizations who are servicing our indigent population, just for their ability to provide those kinds of products to their clientele. They're having great difficulty doing that. As far as now that the school is going to be doing distant learning, I know Cecilia was very concerned, Ms. Rosales was very concerned about the youth needing iPads and the ability for each of them to do work remotely, be it at their home, or there is actually several youth that are having to go to the office because their foster parents are an essential worker. And so I'd like for us to really consider, and I know that through Natalie Green, Ms. Green's research she did with the current service array that we provide, that Families and Youth Incorporated are asking for those kinds of things like computers and or iPads to assist the kids that are in the local shelter as well. So I've worked many a case management positions that establish indigent funds and or indigent, and we usually worked at 185 to 200% of poverty. I don't know if in the conversations that we have been having as it relates to Terra Winners and the established fund, if we, along with the Casa de Peregrinos, I'm assuming it's income-based and the people need to fill out a mini application. And so looking at that and really providing the funding necessary to help with that particular fund through the community foundation would be something I think that I think that we can explore. I've also would really like to see at least $250,000 more into the utility fund. I'm sorry that Dr. Garcia isn't present to be able to tell us how quickly that fund goes. And honestly, I don't have a sense in the 4 years that particular office utilities doesn't ever come and ask for additional funding because they have found that additional folks are in need of it. So I'm not sure what that process is. That has been in place, I think, for a considerable amount of several years. I don't think the 100,000 has ever changed in terms of the amount that we provide in the budget. I had also heard from Loaves and Fishes that provide elderly food distributions in the tune of $3,000 for boxes that they're in need of. And I had also mentioned one of the things that I'm concerned about is we're going to have to look at this, Mayor, is I'm so grateful to Senior Services and to Parks and Rec that is assisting on that curbside and congregate meals. But I think it only happens Monday through Friday. There is not a lull for the weekend, and I think we need to really consider a weekend distribution. I've heard of several instances at some of our local grocers where people are in the parking lot sort of asking for assistance. Not only does it break my heart, but it's something that I think we really need to move into in terms of providing weekend distributions, I think. The other thing is that in talking with the schools.
Excuse me, Counselor? Mayor Pro Tem, it looks like David wants to jump in. Maestas, can I let him? Maybe he wants to address something to you. David?
Yes, thank you, Mayor. I appreciate that. Just to answer some questions about the Utility Assistance Fund that has been brought up. Last fiscal year, it was at $75,000. It has been bumped up to $100,000 for this year because it does get expended. In fact, we're pretty close to being out of that money right now. So we definitely, if that is the council's wishes to see additional funding there, well, that definitely falls in line with what we're seeing with the trend. But I did want to update Mayor Pro Tem, and also Councilor Bencomo based on the questions that were brought up about that. So thank you.
Thank you, David. I'm sorry, Mayor Pro Tem, go ahead.
Sure. Thank you, David. I appreciate that. The other thing is, Mayor, we had talked about this. The schools are finding it difficult as to deliver at least to a little over 120 people. That's 76 meals during the week to hard to reach families. And so they've reached out to me specifically to see if we can help distribute meals. And I'm wondering if that might mean Parks and Rec people or somebody of that nature that could help the schools in distributing the meals that they're having difficulty at their sites. And this is because social workers and counselors are reaching out to families that they haven't heard from, and families are saying we're having difficulty sort of getting to your site. It's a busy street. You know, like the example that was given to me is going to MacArthur and living on the other side of Motel Boulevard. How busy that street is. I don't know how busy it is or isn't at this point in time, but I also made mention of the $15,000 allotment to Crucis Creatives. They have done quite a bit to research and design fabric masks, 3D printed plastic face masks with cartridge filters, and I, you know, I was hoping that we'd get a more definite information from the hospitals in terms of it sounds like they have enough, but tomorrow that might not be the case. I just saw an email that we got some confirmed cases, and so I just want to put a pitch in to being able to be prepared. I too am concerned about, I feel really strongly that we need to do what we can to address our most vulnerable population. And I continue to be deeply concerned about our elderly, our disabled, those that have mental illness, that are having great difficulty because much of the system or the services has now gone to telehealth. And so I am reading articles and hearing from folks that that's really very difficult for someone who can't afford for internet. And so some of the things that I'd like to encourage our communications department is to put information about the suicide hotline and mental health, sort of a public safety announcements, service announcements around mental health. And I'm happy to, there's some very reputable sites that we can take information and be able to post on our
Hello, Cisco Unity Connection Messaging System. From a touch-tone telephone, you may dial an extension at any, enter your ID, followed by pound.
Sorry, Mayor, I think somebody has gotten disconnected and trying to get back on.
That was David Dallahan.
So I think that whatever we do, we need to stimulate the economy, and I know this is really difficult. We have some immediate needs in our community, but I also feel like if we don't do something to stimulate our economy around ensuring that we're getting GRT and, those kinds of things. For example, like a building of tiny homes. I've had some conversations with Families and Youth Incorporated and maybe and with Nicole Martinez at Community of Hope. Maybe that's a way to keep us afloat as we are during these challenging times is thinking about what are immediate, what are our mid crises type, because I don't know that we're out of the woods at this point. I think we need to have, continue to have conversations about how we help our most vulnerable. So thank you, Mayor. That's all for now.
Okay, thank you, Mayor Pro Tem. Councilor Sword? Councilor Sword?
Yes. I was actually at the same time looking at some of the information we've gotten on the CARE Act and other things. Yes, we have one more case here in Doña Ana County now. It's a very good discussion. There's a lot of things that we need in this city. This is no doubt the most amazing crisis that we may ever live through. As I hear everything, I hear the things that we need to do and so forth. Here's what I'd like to have staff do. I'd like to have staff go through what the state and the feds are doing, federal government are doing in every one of these things that the counselors have brought up so far. Get an idea of what the feds and the states are doing for that. And then fill in the gaps. If there is a shortage someplace, fill in the gaps with whatever we can do. I think that would be the best way to go. And then for certain things, establish a threshold that you're not going to spend this money tomorrow because it isn't needed. But there's going to be a point in time where it may be needed. Establish that threshold where we automatically go ahead and put the money out to do this. A case in point would be the masks, as we heard today. There was something else here. What have we got here? Yes. But we still have to understand what this whole coronavirus, the whole COVID-19 is doing to the city government too. We have to keep that in mind at the same time. So we have the big picture. What is this whole virus thing going to do to the city government and so forth? And that way we can make the best educated, informed decisions on where to go forward. Again, I like all of the proposals that councilors have presented so far. They're all good things we need to do. The utility assistance was well described by David. As in my 10 years of being on the Utilities Commission, yes, we've had 75,000 in that fund, and gradually over the years we've gotten closer and closer to that 75,000. And then finally we hit it last year, and so reason why we bumped it up to 100,000. So adding another 100,000 to that would be a smart thing to do, and so on. And then, like I said, as far as the other ideas that we have our staff go through and see what the federal government is doing, what the state government is doing to help all these different people's businesses, et cetera, and then make decisions after that. Thank you.
Thank you, Councilor. Councilor Vasquez? Oh, Larry, you want to jump in there?
Yes, sir. I was just going to comment on the council's observations and proposals and what Councilor Sorg just mentioned. The community improvement program with the community development has several items that Natalie Green will be presenting here in a few moments after council has their items brought forward. I think it would be very helpful to hear about those, particularly because they're vetted from the federal government as well as state.
Thanks, Larry. So it looks like we'll go back to Councilor Vasquez.
Thank you, Mayor. Thank you so much. And thank you to my colleagues on the council as well for understanding the need in this moment, right? I think I looked at the calendar today knowing that one, I was blessed to have a job that I can pay my rent with tomorrow. I'm hearing a little bit of an echo. I don't know if somebody needs to go on mute. Thank you. And knowing that there's other families in the city that don't have that same luxury, right? That aren't able to weather the storm, that are probably at this very moment sending emails or text messages or calling their landlords to explain to them why they can't meet their financial obligations because they've been laid off due to no part of their own. And so I really think that we need to act quickly to help those people. Yes, will some of them be getting financial help from the federal government? Absolutely. Will some of them be getting unemployment benefits from the state of New Mexico? Probably. But there's a lot of people who will fall in the cracks, including undocumented workers, right? Who us on an everyday, non-crisis situation, benefit from their labor, benefit from their presence in our community, whether they're working in the back of restaurants or whether they're working construction or at hotels. We all seemingly don't mind them being invisible until a crisis like this happens, and then we have to think about who it is that powers our economy. And so I just want to make sure that us as a city, that we are doing the most that we can to help our people, and not abdicating our responsibility to others, the state or the federal government. That's one of the reasons I'm in this position, right? Because the people of my district are looking for leadership from our local leaders. And so I will just go quickly through some of the rest of our proposal, which you all now have in your inbox. I just checked my city email, and I think you all should have the PDF there of what we're proposing. So I do want to reiterate the Workers Relief Fund. That's the first thing I mentioned today, which would be an allocation, as Councilor Sorg mentioned, on an as-needed basis, if it's exhausted, of $1.5 million with a monthly cost of $500,000 per month. That would actually be able to be absorbed by the Community Foundation of Southern New Mexico's Together Las Cruces Fund, which is currently taking applications to distribute $250 to $500 checks for the recently unemployed or self-employed who have lost business, including to also include undocumented workers and mixed status households who will not be receiving federal financial relief. The idea that we had for the local restaurant and small business relief fund was that we could have eligible small businesses sign up to participate in some type of city relief program, and then essential employees who are all having to work today would get vouchers that they could spend at local participating small businesses over a 3-month period. And our proposal for that expenditure would be $1 million over the course of 3 months. We also have a rent and mortgage relief fund, which would be a one-time expenditure to help local residents who have lost their jobs or whose income has been impacted significantly as a result of COVID-19 pay up to 50% of their monthly rent or mortgage. And we think that this would be a program that could be administered by the Community Foundation of Southern New Mexico, assuming that we would put $175,000 in on a monthly basis. We could, this would be a 3-month cost of $525,000. The program that Councilor Abeyta-Stube mentioned earlier to help victims of both domestic violence, but also any type of nonprofit organization that assists with social work, with hunger, and also those who deal with our homeless population, that nonprofit organizations in our community on a case-by-case evaluation would be eligible for a $50,000 grant to help provide the services related to domestic violence, emergency food services, family counseling, child welfare, and temporary housing, to both expand their capacity to provide services to individuals and families that are impacted today, most of which I'm assuming probably have existing relationships with the city. And hopefully, Councilor Gandara, that would cover some of the nonprofits that you have in mind in terms of being able to provide those services that are being needed in our community today. the one-time expenditure on that we'd like to see is $400,000. And so that's potentially 8 grants, 8 $50,000 grants to 8 local nonprofits that deal with that population. Increasing the utility assistance fund as appropriate. We would also love to see, and then Mayor, to your previous proposal of delivery services and quarantine lodging, absolutely would like to see that if there is a need in our community for that. Is obviously for us to be able to provide those services. And I know the state of New Mexico right now is considering an emergency legislative session to deal with this particular situation. Mayor, you mentioned the anti-donation clause and the need to, especially in an emergency situation, be able to make decisions quickly and effectively that benefit our community, that help our people. And so I think we need to go to the governor and say, hey, in this next upcoming emergency legislative session, local governments need to have the authority to do what they need to do to keep their economy afloat in a situation like this, help the people that need it the most, right? We're not trying to play favorites. We're not trying to corruptly give money to small businesses or private entities. I think that much is clear. And so asking the governor and asking our state legislators in Las Cruces for something that's actually feasible in this upcoming legislative session that would allow us to do this if it's not currently legally a viable option per the direction of our city attorney, is that we have to find a solution for it and we have to fight for it, because many of you have mentioned today, we've never seen anything like this. Local governments aren't set up to deal with situations like this. And so either we say, well, too bad, legally we can't do it, or we do everything we can to help our constituents, right? And that involves talking to our legislature. That involves perhaps treading on those legal lines of what we can and can't do and ask for forgiveness later, because there won't be another situation like this. And I can't think of any better reason than to use our Telshore Fund monies than for the health of our community. This is literally the health of our people, the health of our small business economy, right? What generates taxpayer dollars with our GRT, but also what protects our elderly, our workforce. And so if you sense a little frustration in my voice, it's because we're not adequately prepared for this. And what I want to hear is more potential solutions rather than saying, no, we can't do that, because I don't think we're ever going to be in a situation like this again. And so we have to get it right. We have to do what we can to fix this situation at the state level, at the local level. And anyhow, that's our proposal that we have. Certainly it's fluid. It will change with whatever responses our community actually needs, with whatever we can legally do. And also with what our state legislature and our governor is willing to work with us on. Because we do have excess funds. We can use them. We should use them. This is the rainy day. I mean, you say we have rainy day funds. It's raining. It's hailing, right? It's like we need to be able to use this money now, or else what the heck do we have this money for? So those are the ends of my comments. Thank you, Mayor, and thank you to Council as well.
Thank you, Councilor. I think Natalie Green wanted to, so she had her hand up. I don't know if she still wants to jump in. Natalie, did you have something you'd like to say?
Oh, good afternoon, Mr. Mayor, members of council. I was just going to give you an update on our federal funding. I know most of you saw it through the email, but we do anticipate getting CDBG funds. The federal government has increased the CDBG entitlement fund by $5 billion. So that will be a formula distribution, and we should get word within the next no later than 30 days. We anticipate it much sooner on how much additional federal funding we will be getting. And staff will be working to bring those substantial amendments to our action plan forward and an allocation plan forward for those fundings. Most likely what will happen is that we will build upon our existing relationships with our nonprofit partners. That'd be Community Hope, Casa de Peregrinos, Jardín de los Niños, La Casa, and Mesilla Valley Casa for our CDBG funds.
Thanks, Natalie. Can you, I don't know if you've been listening to the entire meeting on some of the proposals. Is there something that you can pick out of the CDBG that you think can closely meet some of the concerns that have been brought up?
Look, I pulled up the possible things that we could do. A lot of that would be, it's probably going to be agencies that we're currently funding. So additional.
Let me ask you this. So let's say we have some residents who live in that are public housing, the Sea Valley Public Housing Authority. Can that be treated a little bit different since we know that they are a certain income level, those that receive a good portion? How does that work? Is the housing authority? I know they have eviction powers. I know they can't do that right now, but I mean, how does that work? Is that something there that we could give to the housing authority to help offset that's kind of a rent relief, so to speak?
I haven't reached out to the housing authority. They do income qualify all their clients, so we could look at those policies and see what we could model or mirror if we were going to do something similar. As far as I know, based on the information we're getting from the federal government, the public housing is getting additional funding. So they are going to have their own funding source to prevent any evictions or any interruption of housing vouchers. So those people will continue to be housed and aren't going to have any issues. And they won't be getting evicted if they can't make their portion of their payment.
Okay. All right. Thank you. Before I get to Councilor Bencomo, I got a quick question to ask our city attorney, Jennifer Vega Brown. Jennifer?
Yes, Your Honor.
Yes. So Jennifer, and I'm sure, so does the anti-donation clause also apply to the state government? And if so, does it, like for example, the unemployment money that they're giving out, is that, I know that's paid a lot by the employers, they pay a certain percent, but is that matched by the state at all?
Mayor and Council, I'm not sure about the unemployment funding. It is matched by the employer, and the employee also pays into unemployment. However, I'm not really sure how the funding formula works for that. The anti-donation clause does apply to state government. There are some specific exceptions. One of them is LEDA. That's an exception because it has to do with economic development, but that's a specific statutory exception. There are other exceptions for, I believe, scholarship aid to veterans, student loans. Those are areas, and I have to say that there are a lot. If you just look online about anti-donation, you'll see some legal scholarly articles about the need to reform that provision. There's a lot of gray area, and there's not a whole lot of case law that really defines what it is and what we can do. It is a constitutional provision, so that kind of takes it into a different realm of, so it makes it a little bit different. But yes, it does apply to the state, and there are a lot of limitations.
Okay. The reason why I was asking is I wondered if we could give money to the state that allow them to then trickle it down to those that are in need. But
well,
we can get.
Mayor, the anti-donation does not apply from government to government agencies. So, for example, we could assist Las Cruces Public Schools, and anti-donation is not affected. It's a government to government. We can't.
Right.
Any state agency.
Right, but for the sole purpose of them having this money then to distribute either to others in the forms of unemployment, even though they may not have been employed. Some of the things that or they were employed but may not be documented. So some of the concerns that the councilors Vasquez and Bencomo and Stubbe brought up, I'll talk with you about that. I was just thinking, thinking different, in different ideas. Okay, so we've got Councilor Bencomo, looks like.
Thank you, Mr. Mayor. And thank you, Ms. Green, for all that information and for the email you sent out earlier. I'm curious about the wireless that we provide downtown, the free wireless. So now that schools are canceled till the, well, not canceled, but they're all home till the end of the school year. I know that I think the census for Las Cruces says that, oh my gosh, I think it's like, it says that 23.9% of households in the city of Las Cruces don't have access to broadband. So I can't even imagine what some of those kids and some of those parents are going to have to go through in terms of trying to figure out how they're going to be schooling their kids now without access to internet. I'm curious about how we are able to provide free internet in public spaces downtown, the cost of that, and potentially expanding free internet access to low-income families in the city. Can any staff answer that?
You know what, Counselor, if I could take a stab at this, I think that's a really good point. I think, and let me pose this question to Jennifer. If I recall, Comcast or Xfinity has a program if the children meet either like reduced lunch or free lunch, they get high-speed internet for $9.99. I don't see why we can't, as a city, purchase internet for those children that qualify, even if it's for 3-4 months or whatever, or maybe, definitely, I don't know. Is that something you think we might be able to do, Jennifer?
Mayor and Council, I know that was addressed in our franchise agreement, or I'll have to look at our franchise agreement. I know it's so out of date right now that I'm not really sure if that's addressed or if we anticipate addressing that in our next franchise agreement, but I'll double check that.
So, but if, let's just say let's say it's available, because I know it's available now, that they can get it for $9.99 a month. And it's only for those children that qualify for free or reduced lunch, which obviously that's based on income. If their income level of the children meet that of the definition of indigent for us, could we not provide internet for them?
I will look at that.
Okay.
It becomes problematic, but one of the things that you can do is partner with the schools to identify.
Oh yeah, right, exactly. Give to the schools. I'm sorry, we were going to pay directly to Comcast. Yeah. They would go to the schools, and then they would in turn be able to. Okay, can we look at that also? I have a list here, but I'm just writing it down. But okay, I just when Councilor Bencomo brought that up, I thought of that. So, thank you, Councilor.
And then since we're on that, I would love to also check, can we support them in purchasing computers, surfaces, laptops for the kids that currently don't have any as well? And so maybe that's a question we can also ask the schools if they need support with that. And then my last question is, are nonprofits currently able to apply to request funds from the Telshore Fund, or no? Or that's not how that works.
They can, Counselor. Like for example, or we can, like for example, I think Mayor Pro Tem Gandara and even yourself, I think brought up La Casa La Piñon for additional. I think Counselor Mayor Pro Tem Gandara said like 15,000. I think like 100,000. To be able to take blocks of rooms and have them available so that when they need them. I don't see why we can't do that. And then on Community Action Agency, I think while we're at it, we can take a look and see if they have a certain clientele that can be identified as that meets our indigent threshold. I don't see why we can't give money to them as well. That's my opinion, but I'll give it
to Mayor. If I can interject, Mayor.
Okay.
Mm-hmm. They have a couple of Thriving Families program and a meals program that they're providing, hundreds of thousands of services to hundreds of thousands of families. So I at least I think in the tune of 450, and then they have their meal program that they provide people that are providing childcare. So they have their own funding income guidelines, is my understanding, for the programming that they I just want to make sure that we're talking about a lot of folks that are vulnerable, that have children and families, but not to forget our elderly. I think there's still a big piece of our elderly population that is not aware of the senior services that we provide, and are getting caught up in this as well, especially our grandparents raising grandchildren.
Thanks, Mayor Pro Tem. I think this is a big piece of it, right? And I think FYI, Families and Youth Incorporated also provides services to more than likely is identified as an indigent community population. So I think if this is the way that we can support our community through the partnerships, like Ms. Green said, that we already have, I really think we need to look more strongly at how we can do that. And, part of the proposal that Councilor Askest and Councilor Vasquez and I drafted was to look at the drivers for those delivery services that could potentially deliver groceries and other types of, just last week I had a constituent of mine who's an elderly woman who said, I can't find toilet paper anywhere and I don't want to go to the store. Can you help me? And so if we can, directly assist some of those folks in some of these very creative ways, I think the delivery service is a great idea. Another thought I had potentially for that is door-to-door testing, right? As long as people have, those drivers have PPEs and able to protect themselves, but that could also provide testing door-to-door for people who can't leave their homes, people who can't drive, whatever the reason may be. That's it. That's all my questions. Thank you.
And Councilor Micomo, don't let me forget to bring up that the city, my understanding, has some drivers already on our list. And then if we need to use them to either take those kits to Albuquerque, as was discussed on our previous segment, and or helping the elderly deliver groceries and such, I think those, because if they are on Meals on Wheels, I wonder if we can. Someone brought up about something on the weekend for meals. I wonder if we can work with, again, it has to be nonprofits to go out and purchase meals from various restaurants and then use some of those drivers to deliver to the elderly. So this is good what we're going over right now, because we're putting together a lot of different ideas and different ways to, believe me, I'm doing my best to try to figure out how we can get this thing to work so that we help out whether the restaurants, the elderly, everybody that you discuss. This is good things that we're discussing. Let's see here. Councilor Askest, looks like I have.
Yes, thank you, Mayor. Following along with kind of questions about our senior programs, this is for City Manager David Maestas. I know I asked earlier last week about how many senior meals are we serving now per day and then per week with our programs.
Councilor Stuve, this is Lynn Gallagher, the Director for Quality of Life, if I may.
Thank you.
Question. We are currently, let me see if I can do this right. So we are currently providing anywhere from 1,400 to 1,600 meals a day. And we provide those through two mechanisms. We are providing meals through the drive-through at each of the 5 senior centers. And we are also providing home delivered meals, which we are providing the assessments now by phone. We are getting a lot more assessments to do the home delivered meals. And then we also work with Casa de Peregrinos to do the food distribution at each of the senior center sites.
Thank you. Thank you for those numbers. How are you guys on capacity? What do you think, if you are seeing more cases come in, and I expect that'll only get bigger as time goes on here, what is your capacity right now, and how can we help to make sure that all those seniors are able to get those services?
So we have a little bit more capacity at Munson Center site for cooking a few more meals. I believe the numbers that I received as of last week was approximately 100 more meals we have capacity. Our staffing is limited, and some of our staffing are either on quarantine leave or have young children and are on extraordinary leave themselves. So, and then at Eastside, we have a little bit of flexibility to provide some additional meals. Also Sage and Benavides as well. Frank O'Brien, as you know, is one of the sites that we are not only providing meals for seniors, but Las Cruces Public Schools is utilizing that space to provide meals for the students as well.
Thank you. And I think as we move on, if you have any numbers of what you would need, I think that's something that we definitely need to put down.
One of the things that I would, if we're making pitches here, I would like to first acknowledge the city staff themselves, the transit drivers, and the senior program staff who have been diligently providing services to our local community. Sometimes they get forgotten, right? Our own city staff, sometimes we are on the front line and we just do what we do because we're good at it. But they've been doing an amazing job. One of the issues is they too need PPEs. So they don't have masks, they don't have gloves. We're getting gloves. I actually have made, I've made several trips with the bus drivers to help them identify and acknowledge the fact that social distancing is important and we want fewer and fewer people to ride the bus. We also want people to access the food, but they still want to go for the social connection. So it's really making that key for them that they should come and then we want them to go home. My term every day is stay healthy and stay home, come and get your meals, but we don't have adequate gloves. So in your districts, talking to people, giving out that information to your local districts to say, this is where the local food site, senior center site is giving out meals from 11:30 to 12:30 in your district. That's important. If they have those cloth masks, I consider these frontline workers as well, and so they would be very appreciative to hear from their counselors to say good job, and we support the work that they're doing as well. So thank you.
I really appreciate that. And this is where we can come in if we have a place like Mayor Pro Tem Condra was saying, Cruces Creatives, that could produce something. Is it under our availability to be able to pay for that sort of stuff? So at least we can, pay for our own staff to be able to have this type of equipment. Gloves might be different, we're probably going to have to find those somewhere else. But for the masks and everything, is this possible for us to be able to do?
Sure, I think any kind of mask would be appropriate. Again, the food service workers don't need the N95 gloves. We've been pretty successful. We'll give an acknowledgement to utilities. They have identified some gloves for us to give out and distribute, so I will be picking those up tomorrow morning, and I'll personally take them. I've been spending time at each of the senior center sites, just trying to show our staff that we are there for them and they're not the only ones showing up to do this work.
Thank you so much, Lynn. I really appreciate it. And it kind of goes well with my next segue was it's not a financial request, but we really need to have the concrete numbers in our city on what our resources are. We need to know the numbers of what types of PPE we have available in the city so that we can anticipate if we have a surge, what type of items that we would need. I would expect that the OME has done simulations on what those types of numbers look like and what our resources that we need are here. And we need to know how close are we to being able to accommodate everything. And I really think it's something that we need to have those concrete numbers. And it goes everything from how many test kits do we have in our city at this very moment? How many have been tested? And what does that future look like? And how are we doing in comparison with other places in our state? We know that should there be outbreaks in other communities down south, that we will see a lot of their population in our own hospitals because we have the facilities that are able to handle those high acuity cases. And so even if we have, I would say, containment in our own community, we are still going to see other patients from different areas. And so I think we really need to be able to be proactive on any types of planning and just knowing those resources. So I hope that's something that we can do very soon, So thank you.
Thank you. Councilor Flores?
Thank you, Mr. Mayor. So I just wanted to address the anti-donation clause. Yes, it is constitutional, so it would require an amendment. And I have spoken with several legislators about that, Ray Lara, Willie Madrid, and in communication or sent this concern to Joanne Ferrari, Nathan Small, Jeff Steinborn, Bill Souls, and Angelica Rubio. The other thing, so that is something that really has to be addressed, and it's been something that I know I've been pursuing. But at any rate, when I spoke with Joanne Ferrari, she said that the legislature was looking at mortgage relief because we were talking about rent control, and according to our city attorney, I misinterpreted the statute that does have an exemption. And so of course I trust her decision on that. All that being said, I've contacted several people, again, a lot of legislators, about rent control and how that statute has to be changed. The statute has to be changed to allow for certain circumstances that would allow rent control as we do now. And so the other is the evictions. Evictions will require people to go to court. It's not, an automatic, oh, nobody's going to be evicted. Landlords can still evict people, and they would have to go to court. The order by the state Supreme Court was to set aside the execution of an order of eviction. That would require legal aid. That would require someone to have an attorney to give counsel to the evictee. And Angelica Rubio said that she was reaching out to legal aid for their assistance because at first we were very happy to see that the evictions, that there was a stay on evictions, but it's not that simple. And it would require people going to court. And then I believe it was Nakamura who said, the Chief Justice said that people would be provided, they would be able to do something like what we're doing. But not everybody has that facility, laptops and know how to use Zoom and all that sort of stuff. So those are the concerns that I've had in all of this. And we definitely have to do something about changing the anti-donation clause to make it expand it because the only exception doesn't apply, and then the other statute that has, well, that's a constitutional issue, but the statute that would have to change would definitely have to be the rent control, where there is no rent control in New Mexico, but there is an exemption, but apparently the city of Las Cruces doesn't have that kind of housing that gives that kind of exceptions, that allows for that exception or that exemption. So I just wanted to share that information with my colleagues and with the community, whoever's listening to this. Thank you, Mr. Mayor.
Thank you. Mayor Pro Tem?
Thank you, Mayor. This comment goes to Councilor Bencomo's idea, and well, the three that put together, along with you, Mayor, the drivers. I want to circle back with a couple, or at least three of us have really expressed dire concern about people being out and about, especially in our parks and river and those kinds of things. And I would really want to encourage us to pass an emergency proclamation about keeping indoors, and maybe the driving, and maybe it's during a certain amount of time, and maybe the drivers will be helpful, because I think a lot of people are feeling like they need to go to the store and pick up grocery items, those kinds of things, and to be able to say we have a kind of curbside, where we're paying drivers to pick up things and drop it off at your home. I think it's the other part of where I'm concerned. It's not that simple, like to just use the curbside. There are a lot of folks, it's kind of cumbersome to do that. So I can't imagine our elderly folks being able to navigate that easily, especially most of the, or a lot of them don't have like a handheld device, or I don't know if you can call in your orders and whatnot, but I think that we need to really, as a government entity, really consider some of these different outside of the box ways by which our people are getting sort of their basic needs. And the other thing is, well, I think I had forgotten what else I was going to say. I think that's it, Mayor, for now.
Thank you, Mayor Pro Tem. So if I may, just kind of review some of the things that I've heard that we need to do. First and foremost, is we need to get a resolution to rescind the resolution that says that the Telshore funds can be used for other purposes other than healthcare. So if we can get that ready to go, hopefully we'll be able to have another meeting such as this by this Friday. I think we can probably get that done. Don't you think, David? Well, I'm sure we can. Okay, and then,
Yeah, sorry about that, Mayor. It takes me a little while to toggle the buttons.
okay, so
I can get with staff. We will know early tomorrow morning on how soon we'll be able to get that resolution to you, and I can let you know by tomorrow morning what the time frame we'd be looking for, and that way it allows us enough time for the notification of the meeting as well.
okay, that, and then, so let's just say we have another council meeting this Friday. So we'll have that resolution, and then following that, two different resolutions that we give additional fundings to at least La Casa and La Piñon. We need to take a look at Community Action Agency to see if we can do that, and probably even Community of Hope, so that they can have additional fundings for, well, let's just, because I'm sure everyone needs additional space, and those I think where hotels can be used. Jennifer, you want to chime in on that?
Yes, Mayor and Council, I think we'll double check the ordinance, the resolution that we passed in November, because we may have already changed that language based on the asylum seeker situation there. We may have already changed that, but I'll double check.
Okay, good. And then we need to look at the contact Memorial Medical to see if they'll be able to have the money for additional drivers. And if they don't, I think the city has some that are already on our list that we use. So these additional drivers would be for running these tests back to Albuquerque, to work with the Meals on Wheels if they need additional drivers. I think it was brought up that there's some hard to reach areas. Also, I know our drivers already work 40 hours a week, so these other drivers would be working, say, on the weekends. Okay, and then also look at working with the schools to provide additional funding for children at the very minimum that qualify under the low income and free reduced lunch programs. I think they qualify for the $9.99 high-speed internet from Comcast. And then if the schools can identify those families that have no type of computer, whether it's a desktop, whether it's an iPad in their home, well, let's just see. Let's see how Dell has been coming down here a few times and just see if that's something there that we might be able to have them work with the schools to get them some computers to these children. I heard about 100,000 more to the Las Cruces Utilities Assistance Fund. I think that's kind of low. Maybe an additional 250,000, because the way it looks like we'll run through that, and that 100 will go through in no time. And then contact Cruces Creatives to get cloth masks for our transit and bus drivers, for them to have. And you know what, in all fairness to them, they probably should have at least 5 each, so that they don't have to keep washing it every day. They have one that they use every day, and then at the end of the week, wash it, I guess. So at least 5, maybe more. I think I covered pretty much almost what we discussed. Is anyone, let's see, Councilor Sorg, did you have anything you wanted to add? Councilor Vasquez? Councilor Sorg? Going once? Going twice?
Yes, Mayor.
Yeah, got the wrong button there. I'm on now. Has anybody on concerning the schools, have they contacted Karen Trujillo or anybody at the school to talk about these issues concerning the schools?
I have, Councilor Sorg, yes.
As have I, on funding for meals for the parents of the children who receive the free meals. And so that's something there that I think we can even work with as well.
About computers and internet access?
Oh, no, I haven't on that, but maybe Mayor Pro Tem, perhaps. Mayor Pro Tem?
Sorry. I've communicated with them about laptops and computers, especially as they're now moving into distant learning, and they were going to have a better idea in the next couple of days.
Okay, thank you.
Good. Okay, Councilor Vasquez, sorry. Oh.
Sorry, this is Lynn Gallagher. Can I add one thing about Las Cruces Public Schools? I've also been in contact with them to share the resources that are available through the library. We provide a lot of free online content, and I have been in contact with them to let them know how we can help be a resource as well.
Okay.
Can you explain that more, Lynn, further? Oh.
Sure. So our library services, while we do have a computer lab that has about 20 stations, we do have internet at the library. They are not, because of the gathering requirement, they are not allowed, obviously, to be there to meet that. And we want everybody to stay home. We would prefer that people stay home. But we have online book checkout. So if you go to the Thomas Brannigan Library site, on the city site, we are providing a lot of free content so that they can access different book checks out. They can check out books online. They can read resources. We established relationships with organizations like Tumbleroot, and we have music streaming. We have exercise streaming. We have a lot of different resources that teachers can take advantage of that is available through our city service.
Okay, thank you, Lynn. Councilor Vasquez?
Thank you, Mayor. Yeah, I just don't want us to lose sight of a couple of I think, big ticket items in this discussion. One of them being the Community Foundation of Southern New Mexico's Together Las Cruces Fund, which has generously been contributed to by members of our local community here for the purpose of helping the recently unemployed, self-employed, or others who have lost income or have lost their jobs. You know, in terms of what potential areas we have to fill or backfill that the federal government is not doing. Again, this is a fund that's available to undocumented workers and families and mixed status families in Las Cruces. They're not eligible for federal funds. And so I think being able to contribute to this fund from the city, as we did with the asylum seekers, is an important option for us to consider. I know Jennifer mentioned she had to legally review whether that would be a violation of the anti-donation clause or not, but just want to make sure that if we can, even if we're treading the line of legality, I think this is the most important thing that we can do, is to stop people from losing their homes, to stop people from you know, potentially not making rent. And I think the point that Jennifer made was, can we determine that these people who receive this money are indigent? And if so, we can do this. And so being able to determine if those folks are indigent under whatever definition we have to meet is an important next step for me, I think, to determine that. The other piece is the same thing with the rent and mortgage relief fund that we described, right? If we can right now provide money to people to pay for their utilities who otherwise can't, and those people are considered indigent or legally were able to do that, to Casa de Peregrinos, how can we apply this to other nonprofits, and how can we apply this to things besides just the city utility? That seems like a very self-serving thing, you know, for the city to do. Like, hey, we'll give you money if you have to pay for a city bill, but nothing else, right? But in reality, it's
Councilor, that was just me thinking out loud. I don't know.
No, not on your part, Mayor. No, I mean, just in a way that program is designed, I think, in terms of, you know, if we can apply it to other basic human needs besides water and gas and wastewater service, then we should, right, legally. So I think, you know, being able to explore what our options are under what we're currently doing with that program and expanding into housing and that kind of thing is important. And then the other thing I wanted to make sure to also capture is from MMC's perspective, Mayor, you have outlined this very well in terms of what should our priority be, and that's the health, certainly the health of our community first. And so hopefully MMC can come back to us with a memo of recommendations that they can provide to the city of things that we can be doing from a health and public safety perspective that we can look at for next Friday's meeting, if there's any actionable items in there for us to have best practices on. I think hopefully there's some consensus amongst the council that perhaps an emergency proclamation that gives some teeth to this idea of enforceable social distancing practices in the city, that might be a direction we want to go in the next couple of days, right? So that we can actually prevent people from paying those pickup basketball games on a Sunday, as much as it pains me to do that, or a Saturday, to prevent, you know, 6 or 7 people from gathering, folks, you know, getting together at the park. All the things we normally try to encourage and stimulate and build community with, we're now telling people they can't. It's hard to do. But I think we heard from our health professionals today that that's the number one thing that we could be doing. And so would be looking forward to those recommendations from MMC on what else we can be doing as a city to limit those activities and keep our community safe. I did just look at the email that came in from with the latest results of the growing cases in our state. I think there's only 1 new case in Doña Ana County, which is spectacular, right, in terms of where the trends are in other places. So I want to keep it that way, and I want to be as aggressive as possible and keep it that way. So thank you, Mayor, for running this meeting. I want to thank the staff also for doing a tremendous job under emergency situation. They put this all together and get us all on the same page. And for anyone who's out there listening from the city, who's stuck with us or who listened to part of the meeting, just to encourage you to keep communicating with us, to your individual councilors and mayors. We are listening. We're trying to do our job as best as we can. And so please provide your feedback. And again, thank you, Mayor, and thank you to my fellow councilors for your leadership throughout this process, and staff.
Councilor Vasquez, I have a quick question for you before you go.
Yes. Yes,
regarding the undocumented unemployed as well as those mixed status, would it, I would think that if we could identify those, we might be able to do this quicker, at least giving them from food to, different utility assistance and things of this nature. It may not be the actual dollars that might, that I think Jennifer's going to be researching, but like, for example, let's say a community action agency knows a certain group that and cannot be identified, and if we were to give them funding, they may be able to do this or do that. And then also same with Casa de Peregrinos, as far as give more money to the food bank, and then they know who these individuals are, and then they can either have boxes for them or things of this nature. Is that something that in the interim at least is something?
I think so, Mayor. And, in speaking with Tara Van Winter over at Community Foundation, with the current fund that they have now, which is, I think, has over $100,000 in it currently, undocumented families and individuals or mixed status families are eligible to receive financial assistance through private donations in the community. But I think obviously the fear is always going to be there from undocumented folks in our community and what they can and can't apply for and what they feel comfortable applying for. So I think what would go a long way at this point is for the city to put out information about what resources are currently available to undocumented individuals and families or mixed status families throughout the network of services that the community provides, as a way for them to come forward and to receive that assistance, in addition to the city being able to provide funds to those existing organizations who serve those populations. So so I think that's a great idea, right? Being able to plug in funds where we can existingly, and then also, making sure that as a city, we're communicating well with that population to say that, hey, here's their list of resources if you are undocumented, that you can access today for food, for rental relief, any number of things, and even including medical screening, right? I'm sure there might be some folks out there who are sick and are thinking this is a big federal operation and they might not go to the hospital, right? And so that might be a good thing for us to do as well, Mayor, is to put some information out on those services being available to everybody. Thank you.
Okay. And I got a question for Jennifer. So, I don't know if you're still there, Jennifer.
I am.
Okay. So along the lines of what Councilor Vasquez was asking, so let's just say, and I'm looking at a meeting this Friday, the 3rd at say 9:30 a.m. If I was to put I don't know, does it have to be an ordinance that would prohibit groups of 6 or more persons gathering in public places such as public parks, any athletic facilities, or any other public gatherings until say April 13th? Does that have to be, can that be put on Friday's agenda, or does that have to be done as an emergency proclamation?
Mayor and Council, you've already passed the emergency ordinance, so all you would need to do is to have a public proclamation. You don't need to pass an ordinance. That was the point of passing the ordinance that we just passed last week. So you would just need a proclamation, and you can mirror the language of the governor's mandate. I believe it's 5 or less individuals. The one thing that you have to consider is enforcement of that, because, and we can talk about that with Chief.
Well, so I guess what I was trying to get at is, if I wanted to, could I, instead of it being an emergency proclamation, say today or tomorrow, can it be put on the same agenda as Friday, if needed?
You could you could have a resolution to do that. Yes, you could.
And it could be effective immediately after it's passed.
Yes, you could do that.
Okay, well, I'll work with you on this wording. That's why I didn't want to, again, as far as enforcement, there's a couple other things that we need to look at. But
Mary, if it's your desire to get a vote on the language, then you can do the resolution. If you just want to do the proclamation as, you don't need a resolution, is all I'm saying.
Well, I want to have it before the weekend. So if Friday, as long as it's before Friday or before Saturday, the 3rd, I think
Mayor,
we're okay.
Mr. Mayor? Oh,
Yes, Councilor. I got Mayor Pro Tem Gonda first. Councilor Flores, if you don't mind.
no.
I guess I think what I'm hearing Jennifer Vega Brown say is that we don't need a resolution to do this. You can do this tomorrow with an emergency proclamation. We don't need to vote on it. You have to come back, right?
I agree. No, I agree. It's just that whether or not I just want to just put it included on Friday's agenda, because it'll accomplish what I was hoping, and that is before the weekend, and not necessarily have to, make it such a, an emergency. You know what I'm trying to get at. The order would still go through effective Friday, and so that it prevents on the weekends.
And Mayor, also, if what you're thinking is you would want it to be the 7 days or to run concurrently with the state for up to 14 days, then that would be appropriate to put it on the agenda.
Okay, yeah, that's what I was hoping to do. Councilor Flores, were you wanted to chime in on that?
Yes. Yes, Ron. Yes, the same, on the same proclamation, the same, and yeah, my understanding is that you can do the proclamation if you want it to kick in.
Oh, yeah.
Right. But I really, I don't know, the city attorney would have to chime in on this one too, but I would really like to see a curfew, not a lockdown, but a curfew, just to drive it home. And then, as the city attorney has stated, we need enforcement. There has to be some teeth to any proclamation regarding, 5 or less language, or if we also add a curfew. And the reason for that is because it really has to be driven home that people have to understand that you just can't be out willy-nilly because you ran out of, your favorite perfume or something and you make it over to the mall. So I would like to see that language in there. I don't know how other councilors feel or how you feel.
Well, Councilor, I appreciate that, and I have to tell you, I guess I would probably, I don't think we're there yet, and let me tell you why. Because once we put a curfew, now you give anyone, let's say whether it's 10 o'clock or midnight, it's my opinion that if a vehicle's out there, let's say legitimately going to work or doing what they need to do, can get unfairly pulled over, and it could look like it's being harassed when it's not. But want to know, why are you being out? Why is it 12:30 a.m. and you're out on the drive? Well, I work the midnight shift, and so
I understand
think
that, but let me just say in response to that, the city of El Paso has that now, and what two of my cousins had to do was get letters from their employer indicating that they work at such and such a place. So they haven't been able to enforce it, but that is out there, and it carries a fine of $1,000 and even some time I think in jail. I don't know what the penalties would be, but it's just that people are not taking this seriously. And if we have language in there that says that we are setting a curfew, not a lockdown, but a curfew, because I think that because there has been limited testing, I don't think we have the right numbers. I think that as Councilor Buenfomo brought up, if we had the facilitation to be able to go door to door to really find out, because I think that there might be some people out there who aren't stepping up for a myriad of reasons. So, but the stay-at-home thing and the curfew, I think the curfew will drive home how important the stay-home message is and how that's going to curtail any kind of, spread of this virus. That's my opinion. I don't know if anybody else supports that, but that's what I would ask.
I appreciate that, Councilor, and in all due respect, I don't know if, that's why I wanted to try this, prohibiting of groups of 6 or more, or of greater than 6, I guess I should say, which
No,
basically
greater than 5.
No, greater than 5. You know, because I think that's where the biggest holdup is. Gosh, it's very difficult to start restricting people. You know, I understand that, but I mean, it's just, it's, I may want to just try this first.
Okay.
Let's see, who else was here? Councilor Bencomo.
Thank you. Thank you, Mr. Mayor. I have a couple more notes. Thank you for, first of all, Mr. Mayor, for making that list. I'm glad that you were taking good notes. I think that for now, that looks like a really good list. I'm really glad that Councilor Vasquez mentioned the Together Las Cruces Fund. I mean, I think we've seen over and over again that this community is incredibly resilient, that Las Cruces love each other and support each other. And to me, it feels like if there's been private citizens who've been donating to this fund, the city should be able to as well. Like that is what government is for, is to take care of its most vulnerable. And so I'm glad that he reiterated that. On this point of curfews and a punitive enforcement for stay at home, I don't know that I would support those. I think we have to be careful when we're talking about harsher policing in this moment. I actually wanted to ask Chief Gallagher, if he's still on, about what their sort of processes have been like lately. I know that the county jail released people that have been releasing some folks, and I think that that's a good thing. I think people in small spaces like a jail is a bad idea, especially if they're simply awaiting a court date because they can't afford to pay bail. And I think we should really consider temporarily ending nonviolent arrests. So to me, asking people to pay a fee for being out is the opposite of what we're trying to do right now with this relief package. We're like adding more debt and stress to people when I don't think we've tried different ways first. I think, Mayor, your idea of doing some sort of stronger order, I could support a layered, perhaps a warning, second warning type of thing. I feel really uncomfortable with the idea of this being punitive at this moment. And so maybe I do want to come back to, so I'll end with my nonviolent arrest question, but I wanted to add a couple things. Actually, no, just one. Public input, where are we on the status of ensuring that the public is able to provide input during our Zoom virtual meetings? I think I'm really glad that people are home and I hope they're watching. But I'm sure they're feeling frustrated that they can't give public input right now. It's such an important topic. And so I'm wondering what the status of that is right now.
I'm sorry, Councilor, what was that last question?
Just on public input during our virtual meetings.
Oh, what has been the status of that?
Yeah.
Mayor, if I could address that for Councilor Bencomo. Councilor Bencomo, staff has begun to look into that. The discussion we had about the limited public forum, there are several criteria that we need to make sure we have in place. So for a resolution based on our timelines for getting them to council in advance timeframe, we were looking at potentially the second council meeting in April. If we were to have a separate meeting, well, we could look at a different time, but right now with the current calendar, that resolution would be coming to you for that second meeting. And then what that would do is allow us the ability to seek input, either kind of like we did now beforehand or during the meeting, during our Zoom conversations. What we did for this one, if you might recall, we added language in the agenda notice to let people know that if they had any comments or they wanted to pass on any information to their council, they could do that via the email addresses that we provided or by phone call. So I'm not sure if you got several items from your constituents that way, but as mentioned previously, we're looking at having a resolution ready for you probably a second meeting in April.
Thank you, David. Yes, I definitely did get emails and text messages and Facebook messages from constituents, which I'm really thankful for and I'm glad. And So I do want to let people know that we are reading them and we are listening. I think, and I know that staff is working really hard on this. I know that this particular virtual meeting came sooner than we all had hoped. So I know that people are working hard on that. So I appreciate that, David, and everyone else working on it. I'm sharing it. They're far away from me, but tech guys here. So they're working hard today. So yeah, my last question then will be to Chief Gallagher. I'm curious, Chief, if you're on, what are sort of some of the processes that you've seen in terms of arrests? Like, who are we arresting? Are we putting people in jail right now? And I obviously understand that for those that need to be because they're violent.
I am on. Can you hear me?
Yes, there you are.
So, yes, we have made some changes. I prefer not to get into the specifics as to who we are and who we are not arresting for public safety reasons. I can say we have reduced, to the extent possible, the interaction that our officers have with the public. You can read into that what you will. I can also say that our mission today is changed to twofold, and I've made this perfectly clear to all the officers and city management. The mission now is one of sustainability for our officers and one of visibility for the public. So I do have some concerns that I will share with the mayor and the city attorney and the city manager with regard to the declaration of an emergency. I've reached out to my command staff and get their opinions as well. We are seeing a drop in calls for service. That's a good thing. We have realigned some of our services, allowing for more officers to be on patrol for that visibility component of that twofold mission that I mentioned. Some of the crimes that we're seeing year to date, the crime had been up, again, increased as compared to last year, but a switch from last year. If you recall, last year we saw a drastic increase in violent crime. This year to date, we have seen an increase in property crime. Comparing March of this year to March of last year, it's pretty static. There hasn't been much of a change, but what has changed, as you can imagine, with the increase of people being required to stay home, there's been an increase in domestic violence calls. The most prevalent call for March has been people asking us to check on the welfare of their friends and relatives. So that's a good thing. People are concerned and caring, and we've been called upon to do that. My concern with regard to some of the enforcement regarding the groups of 5 or more is to the sustainability aspect of it. We have to be prepared to be in this in the long run. Currently, we have 5 officers on quarantine leave due to travel. Thankfully, so far, we haven't had no officers test positive. We had 1 officer get tested because he was symptomatic. Thankfully, that came back negative. My concern with increased enforcement at a time like this is putting more officers in contact with people who may be sick, thereby adversely affecting the staffing of the Las Cruces Police Department down the road when we may need them the most. That's all I really need to say right now.
So Chief, let me ask you something. Using the state's directive, if let's say a New Mexico State police officer witnessed a group of, I don't know, 20 kids all hanging around somewhere, could they have the authority to break that up?
They do. Right now they do, and what they're doing is similar to what we're doing, is requesting voluntary compliance. I just spoke to the state police captain down here. They have not begun enforcement in terms of citations of arrest. I can tell you, with regard to arrest, nobody would probably be arrested for this.
Sure.
Just be given citations for this. What they would happen in court would be up to the judges, but I know judges are kind of putting off anything that's nonviolent to down the road. So I'm not sure if the citations would have the desired effect.
Okay, so then we could have asked residents, if they see something like this, to notify their counselor or me or whomever, and then your department, in conjunction with the state, at least at the very minimum, remind them, hey, even if they have to use a megaphone, I don't know, I watch too much TV. Does police cars still have those megaphones where they can talk into their...
We have them in the vehicles, yeah, and that would be my
preference. Just say, you guys are violating the state directive, or please disperse your crowd or something like that. And let it go on.
And right now, we don't have that authority to do it. We can request that they move on, and then if they don't, we can call state police. That's
sure, just request.
Any enforcement right now in our attempt would be unlawful.
Okay, so you could request that.
We are requesting it.
Okay, good. Okay, so we need to get that out. Yeah, well, good. Because I really didn't want to put any type of emergency directive, basically saying for people not to gather in public places. But if we can piggyback off the state and be able to utilize them and yourselves to, as if it's called in and state police ask to assist, and you all, go out there and just request, and if they don't do it, then here comes the state. Then. Is that right?
Yes, that's correct.
Oh, perfect, great.
Mayor.
Okay. Yes.
I just want to let you know also, as far as municipal goes, we have asked, I sent a communication last week to Judge Goulban and requested that she allow the attorneys and the police officers to appear telephonically if possible to reduce possible exposure. And we did a search to see how many defendants were being held on municipal charges in jail. There were only 4, and I took action to release all 4 of those. So we are trying to reduce court appearances and not increase court appearances. Just for
Very good. Great. Thank you, Jennifer. Looks like the last comment, or Councilor Bencomo, were you done? Yeah, okay, you're done. Mayor Pro Tem Gandara.
Thank you, Mayor. I do want to say that Tara Winters reached out to me, and there is an application process. It's like it's live on their website. They've already received 200 plus applications, and looking to receiving at least 24 daily. And so some of the questions are, have you lost your job? Have you applied for unemployment? I'm asking if there's an income guideline. I'm trying to really pay attention here and there as she's sort of sending me information. So I think to the counselor's points about really trying to not forget about this fund and how beneficial it can be to folks. And to Councilor Sorg's points about asking staff to look at sort of the care package and what if you're unemployed, what you're getting, how quickly you would get that funding, and how much that would be really important, because I think it's important to ensure that things are done expeditiously and not that we're waiting weeks and weeks and weeks for people to get sort of the aid. The other thing is I was going to make mention, and thank you, Councilor Bencomo, for bringing that up. I think it's really important that the public is aware of sort of these proposals. They've been floating around, and there's no real way to sort of share with the public unless I put it on my Facebook and send it out. But I think it's important that as we move forward and we continue to have these sort of virtual meetings, that we do everything possible to garner the public's input. I understand about criteria and crisis in these sort of times, but I think it's really important that we get public comment, especially, again, like I said, these proposals that are being put together quickly and not shared with the public, so public has an opportunity to weigh in on them beforehand. The other thing is I'm trying to read my notes here, and everybody knows my scratches, my chicken scratch. I want to move back to this stockpile. Again, there's and I didn't hear it mentioned, Mayor, and you're sort of as you're reiterating things. I think it's important that the city provides some sort of stockpile of these sort of items: diapers, formula, hand sanitizer, the masks and such. And it's to the point of these large organizations are having trouble. So shouldn't we have, I don't know if the city has an opportunity to be able to get those reasonably without struggling to get them. I'm not sure how that works, but I still feel really strongly that that we need to do something around that. And lastly, I just want to remind folks about the Telshore Fund and how important this fund is to us at this, especially at this time. But I also want us to think creatively. I think it's easy to, as mentioned before, to look at the other agreements that the contractual agreements we've made, because we've issued out funding via an RFP process. And I want you to know that there are nonprofits that have had great difficulty seeking and being approved funding from this particular fund. And so it makes it difficult for a smaller nonprofit that probably is doing amazing work to get in on this particular fund, because the same usual suspects, and I don't mean this as a criticism, but they're the same ones that get it over time. And so I just want to caution us about it being easy to give these folks when there might be other programs or nonprofits that really need this funding and have not had the opportunity to have a stellar grant proposal submitted and approved. That's it. Thank you.
Okay, well, thank you, Councilor. Well, you know what, I mean, if you have some, if they reach out to you, please run it by me and we'll run it by council. But getting back to the diapers formula, and I'm sorry, what else? Diapers formula.
Sorry, Mayor. Diapers, formula, hand sanitizer, and like the wipes and whatnot.
Mm-hmm.
You know, I mentioned on Friday, like milk products, all those things that have been deemed to limit when you go to the grocery stores.
Okay, were you wanting that to be given away, or were you wanting that to be resold at cost?
Resold at cost, Mayor.
Okay, good. That makes things a lot easier. I think we might be able to work out something, perhaps using some certain drop-off points, or maybe even the senior centers as a possibility. I'll get with Jennifer on that. Okay. Okay, so Friday, this coming Friday, the April 3rd, that should give us enough time at 9:30. Is that we're good to have a? By then, we should be able to shore up a lot of these and start directing staff to start handing out, doing, the funding for this. Looks like a lot of these should work. Okay. And all staff and Jennifer, I'll get you this list if you haven't gotten it already. Okay, then Councilor Sword.
Oh, come on. Oh, there it goes. Sometimes it takes 2 or 3 clicks to hit a button.
Mm-hmm.
Mice are very, troublesome. So are we ever going to have a conversation sometime about how this whole coronavirus is affecting the city government?
Such as?
Such how it affects our GRT revenue?
Well, yeah, I think you had asked that at our last, and I think staff's probably going to put that together. Obviously, there's going to be certain drop-offs from our restaurants and such, but then you're going to see, I think, a lot of these other goods that are just really going up. So I don't know. I would think that we're going to be down at least 10, 15%.
Yeah. So there, it's going to be down. I wonder if our staff has any better idea than.
Now, the interesting thing is, I think the state is, you know, they do it in arrears, so it's like 2 or 3 months behind. I don't think it's like immediate.
Yeah, we won't see it until June.
Yeah, so hopefully it'd be over by then, and then, you know.
But we're still going to have 2 or 3 months where it's going to be effective.
Sure. Yeah. I agree. And but the good thing is maybe we can, there could be some projects that the city has that have been on hold, or, you know, maybe we can start obviously still moving forward with our geo bond things that need to be finished. That keeps GRT coming in and people doing some work, you know. So it's about.
Would you be opposed to using our reserves in the meantime until it's all over? I think we would have an increase in GRT.
Well, I don't think we need
for a while.
I don't think we need to use the reserves.
That's the kind of conversation I wish we could have someday.
Mayor, if I can
Yes, David.
jump in. Mayor, Councilor Sorg, staff has worked on projections based on the changes caused by the coronavirus and a lot of the restrictions that have been placed on businesses and obviously our impact to the GRT. As Mayor pointed out, the good thing for us is we won't really see that drop until we get to the latter parts of our fiscal year, May and June. So for this fiscal year, the decrease will be there, but it won't be as significant. Next fiscal year, we will see an additional decrease as we continue to move further into this. Right now, they are not projecting the need to have to jump into our reserves, our 2/12. However, that is an option if we get to that point, and staff will continue to review and monitor. I can have, if you would like to, for Friday as part of the discussion when we start looking at what funding and what areas for funding might be approved, where we can have staff give a brief discussion. That would be Leanne Demouche and Francisco Payadas, who have worked together on this, Dr. Payadas, and they can give a brief description of where we're at and where they project we might be. Again, keeping in mind that we don't know how long this is going to last, and there could be differences in next fiscal year.
Yes, thank you very much.
Thank you, David.
You're welcome.
Okay, if there's nothing further, entertain a motion to adjourn.
So I'll second that.
Okay, motion made by Councilor Vasquez, second by Councilor Sorg, that we adjourn. All those in favor signify by saying aye.
Aye.
Aye. We're adjourned. It's 5:52 p.m. See you guys Friday.